Dr. Nolan Graves grabbed the rookie nurse by the collar and slammed her into the concrete wall of the supply corridor. Not gently, not as a warning. He put weight behind it, the kind of weight a man uses when he wants someone to remember the shape of their own fear. "You chart what I tell you to chart," he said. Nothing else. She didn't fight back, she didn't cry. She just looked at him with those flat gray eyes that never quite matched the rest of her timid act, and she said nothing at all. 40 minutes later, a Navy helicopter punched through the storm clouds above Harlan County General, and everything Dr. Graves thought he knew about that quiet little nurse began to come apart. Before we go further, if you're new here, hit that subscribe button right now because the stories on this channel don't let you breathe easy. Tap the like button if you're already hooked, and drop a comment telling me what city and country you're watching from. I want to see exactly how far this story travels. Now, let's go. The town of Callaway Creek, West Virginia, sits in a valley so narrow that the mountains on either side block the morning sun until nearly 9 o'clock. In winter, the whole place feels like the bottom of a well. Harlan County General Hospital stood at the edge of that valley, a squat, cream-colored building that had been updated exactly twice in 40 years and smelled faintly of industrial cleaner and old carpet, regardless of what floor you were on. Claire Whitmore had been working there for 8 months. She had taken the night shift because it was easier to avoid people in the dark. She had taken the ER rotation because it was the one place in the hospital where nobody had time to ask you personal questions. There was always another gurney coming through the doors, always another set of vitals to record, always something that needed doing right now instead of later. She liked that. She needed that. She was 34 years old, and on paper she looked exactly like what she pretended to be. A travel nurse who had bounced through 3 different rural postings in the last 2 years, no permanent address, references that checked out and didn't say much. She was quiet. She was competent. She never caused trouble. That was the plan. "Whitmore." The voice came from behind the nurse's station, sharp enough to cut through the ambient noise of the department. She didn't flinch. She had learned not to flinch, at least not where anyone could see. She turned around. Dr. Nolan Graves was standing with a patient chart in one hand and a look on his face that she had cataloged carefully over the past 8 months. It was the look he used right before he humiliated someone. It came with a particular stillness in the jaw and a slight widening of the nostrils, like he was already smelling the discomfort he was about to cause. He was 48, tall, with the kind of build that came from expensive gym equipment and a belief in his own physical authority. He had been trauma director at Harlan County General for 6 years. In those 6 years, 4 nurses had filed formal complaints. All 4 had been quietly reassigned or pushed out. The hospital administrator, a thin-lipped man named Gerald Fitch, had an unspoken policy of deciding that the department couldn't afford to lose its trauma director, no matter what. "This chart," Graves said, holding it out, "has 3 documentation errors on it. Want to explain that?" Claire walked over and took the chart from him. She looked at it. The errors were real. 2 of them were hers. One of them had been made by the overnight resident who'd initialed in the wrong column. But she didn't say that. She said, "I'll correct it now." "You'll correct it now," he repeated, doing that thing he did where he turned your words into a joke by mimicking them back. "Fantastic. While you're at it, correct the one on the Hargrove file and the pre-op note on bed 6. And maybe, I'm just spitting out a wild idea here, try not to make me fix your work 3 shifts in a row." "Yes, Dr. Graves." He held eye contact for a beat too long, then turned and walked away. Marisol Fuentes, a staff nurse who had been at Harlan County General for 11 years and had outlasted 4 trauma directors before Graves, appeared at Claire's elbow the moment he was out of earshot. "Don't let him get in your head," Marisol said quietly. "He's not in my head. You're gripping that chart like you want to fold it in half." Claire looked down. She loosened her fingers. "I'm fine." "Right." Marisol didn't look convinced, but she had the wisdom not to push it. She had learned over 8 months that Claire Whitmore answered direct questions with brief, accurate answers and personal questions with a kind of polite blankness that was impossible to argue with. She wasn't unfriendly, she just didn't give you much to work with. The first 3 hours of the shift were routine. A laceration from a table saw, a kid with a dislocated shoulder from a sledding accident that had somehow occurred in October, 2 chest pain workups that both turned out to be anxiety. Claire moved through it all at the same measured pace she always used, quiet and efficient and careful, charting everything in the exact language that wouldn't get corrected later. At 11:47 p.m., the radio on the trauma bay wall crackled. Harlan County General, this is Callaway Creek EMS. We've got a priority 1 incoming. Male, approximate age 55, penetrating chest trauma, hemodynamically unstable. ETA 6 minutes. Graves was across the room in 3 steps. Trauma Bay 1, let's move. Claire was already moving. The man they brought in was large, former military. You could tell from the way his body had been built and then gradually unmaintained, muscle gone to a different kind of density. His name was Thomas Eckhart, according to the paramedic's verbal handoff, and he had a fixed-blade knife buried to the hilt between his 4th and 5th ribs on the left side. The entry angle was steep. The blade had gone in and slightly downward. Claire saw it the moment they wheeled him through the doors. She saw the angle and the depth and the trajectory, and something in her brain, the part that had been trained for exactly this kind of information at exactly this kind of speed, started calculating. The knife was close to the pericardium, maybe touching it. If there was any cardiac tamponade developing, they were going to need to move fast and they were going to need to be exact. BP's 70 over palp, the paramedic said. He's been in and out the whole ride, pupils equal and reactive. Graves stepped in. Get me a chest tray. Start 2 large bore IVs wide open. Type and cross. I want a portable chest x-ray in the next 2 minutes. Claire moved to the patient's right side and started the IV access. While she worked, she watched the man's breathing, irregular, labored, each inhale triggering a visible wince even through his unconsciousness. The way his neck veins were starting to distend, the way his trachea sat. She said nothing. Graves ordered the x-ray. It came back in 4 minutes. He put it up on the light board and studied it for a moment, and Claire stood behind him and looked at it too, and she saw the same thing he would eventually see, but she saw it faster. Possible hemopneumothorax, Graves said. We'll need to place a chest tube before we touch that knife. Dr. Graves. This was Denny Sorrell, the second-year resident, nervous and eager in the way residents got when the trauma was serious enough to scare them. His neck veins. I think we might be looking at early tamponade. I know what his neck veins look like, Dr. Sorrell. Yes, sir, but if the blade is... I'll make the clinical call here, thank you. Claire looked at the x-ray again. She looked at the patient's chest. She looked at the subtle muffling in the heart sounds when the room went quiet enough to hear them. She had been listening from the moment he came through the door. She could have said something. She chose not to. Not yet. Not with Graves running the room. The chest tube went in. Bloody fluid drained. Expected. The patient's pressure ticked up slightly, then plateaued. Not enough. Graves was focused on the... He didn't see the way the patient's arm moved. Not a voluntary movement, more of a slow gravitational drift, or the way his color was changing under the fluorescent lights. Not the gray pale of blood loss, but the slightly different, slightly purple-tinged gray of cardiac output compromise. Claire saw it, she said quietly. His pressure's not responding the way it should. Graves didn't look at her. Noted. We're watching it. It's been 4 minutes since the tube went in. He should have responded more than this. Whitmore. The way he said her name was a period, not a comma. End of sentence. End of discussion. She went back to her position and kept doing her job. IV fluids, monitoring, charting. And she kept watching the patient, and she kept the things she knew about the trajectory of that knife in her head, quiet and precise and waiting. At 12:18 a.m., Thomas Eckhart's blood pressure dropped to 53 over nothing. His heart rate went to 140, and the room went from controlled to loud in the span of about 4 seconds. He's crashing, Denny said. Graves moved fast. Claire gave him that. He wasn't incompetent. He was arrogant, and he was cruel, and he ran his department like a small kingdom, but he wasn't incompetent. He called for the ultrasound and got it on the chest within 30 seconds, and he saw what the image showed him, and he said, with a controlled professionalism that was almost impressive, Tamponade, we need to prep for pericardiocentesis. The knife, Claire said. I'm aware the knife is there. Whitmore. The approach vector, she said, and her voice had changed. Not loud, not sharp, just different, flatter, stripped of the careful softness she usually layered into it. If you come in with the standard sub-xiphoid approach, you're going to deflect the blade. It's resting against the inferior surface of the pericardial sac. The angle on the X-ray, Look at the lateral view. It's sitting at roughly 40 degrees of deviation. You need to come in left parasternal, third intercostal space to avoid contact. The room went quiet. Not completely quiet. Monitors still beeped, fluid still dripped. But the human noise in it stopped, and every person in the trauma bay looked at the rookie nurse who had just described a technical deviation from standard procedure with the flat, specific authority of someone who had done this before. Graves stared at her. "Whitmore," he said, and his voice had a new quality in it now, not the dismissive one, something tighter. "You don't have the training to—" "We're losing him," Claire said. The monitor agreed. Heart rate climbed. The rhythm started to get ugly. Graves looked at the monitor. He looked at the lateral X-ray. He looked at the monitor again. And then, because he was standing in a room where a man was dying and he was the trauma director and the alternative was watching it happen, he shifted his approach. He came in left parasternal. The needle entered the pericardial space cleanly. Bloody fluid aspirated. Eckhart's rhythm steadied. Not perfectly, not completely, but enough. The pressure came up. The color in his face shifted back toward something compatible with being alive. Graves stepped back. He looked at Claire. She was already documenting. He didn't say anything. But the look on his face, that particular look, the one with the jaw stillness and the nostril flare, had added something new to it. Something she recognized from a different life in a different context. He was calculating. She finished her charting and moved to check on the other patients, and she kept her face exactly the way it always was. And she did not let herself think about what she had just done or what it might cost her. At 1:05 a.m., the overhead intercom crackled with the kind of announcement that usually meant a weather event or a mass casualty drill. It was neither. "Attention Harlan County General Staff. Navy medevac inbound. ETA approximately 8 minutes. Requesting emergency trauma bay clearance. Single patient. Critical status." Claire's hand stopped moving. She was standing at the medication cart with a vial in one hand and a syringe in the other, and her hand stopped, and she stood there for exactly 2 seconds before she set both items down very carefully on the top of the cart and turned toward the window that faced the helipad. The sky outside was black and churning. A serious storm had been building for the last hour, the kind that came down through the mountain passes with a particular fury in late autumn. Flying in that not a medical transfer, not a routine medevac. Whatever they were bringing in, it was bad enough that someone had decided the storm was the smaller problem. Marisol appeared beside her. "Navy? Out here?" "It happens," Claire said. Her voice was even. "Not to us, it doesn't." Marisol leaned toward the window. "We don't have a military base within 60 miles. "Nearest one is Fort Harwick," Claire said automatically, and then caught herself. "I think someone mentioned it." Marisol gave her a look. "You know, for someone who says she's from rural Wisconsin, you know a surprising amount of—" The sound hit before the lights did. The deep, rhythmic percussion of rotor blades working hard against bad air, close enough to vibrate the window glass. The helipad floodlights came on. Through the rain and the dark, the shape of the aircraft materialized out of the storm. It was not a standard medevac helicopter. Claire knew the silhouette. She knew the rotor configuration and the airframe modifications, and the way it sat slightly nose-heavy when it was carrying full medical equipment loadout. She knew it the way you knew the face of someone you'd served with, not consciously, not by working through it, just immediately and completely. She was already moving toward the trauma bay entrance when Graves caught her arm. "Where do you think you're going?" "Navy medevac. They'll need support staff in the bay." "I'll determine who goes into the bay." He released her arm. "You stay on your assigned patients." She looked at him, just looked. Then she nodded and stepped back. He turned and walked toward the entrance, already issuing instructions to Denny and the other residents. Claire watched him go. Then she moved to the supply corridor. The same corridor where 2 weeks ago he had shoved her against the wall hard enough to bruise her shoulder through 2 layers of scrubs. And she took the connecting route to the trauma bay. She got there 30 seconds before the doors opened. The flight crew came through fast and focused, the way military medical personnel moved. Everything purposeful, nothing wasted. 2 sailors and a flight nurse, all of them in flight suits, all of them wet from the 50 feet between the helicopter and the door. The patient was on a litter between them. Male, late 30s, flight suit cut open at the shoulder and upper chest, field dressings dark with blood. Claire took one look at the patient and her chest did something complicated. She knew that face. She had known that face for 12 years, and she had not seen it in 3, and it was currently the color of old chalk and wearing an expression of unconscious agony, but she knew it. Marcus Webb, Petty Officer First Class, later Chief, Special Operations Combat Medic, Naval Special Warfare. He had taught her the left parasternal approach in a field surgery course in Bahrain. He had pulled her out of a river in the Philippines when their exfil went wrong. He had been at her side for 2 combat deployments before she had disappeared from all of their lives and become Claire Whitmore, travel nurse, Callaway Creek, West Virginia. The flight nurse's name tape read Calder. She was talking fast, the rapid handoff language of military medical, precise and dense. Patient is Chief Marcus Webb, 29-year SOCOM veteran. GSW to the right shoulder with secondary fragmentation injury to the upper thoracic region. We've got a suspected pneumothorax right side, tension developing. He's been hypoxic since approximately, and then Calder looked up from the litter. She looked directly at Claire. The handoff stopped. The 2 sailors with the litter both looked at Claire, and one of them, a young man with a quartermaster's insignia and spray of freckles across his nose, went still in a way that was very specific, a postural shift that happened at the spine and the shoulders, and then, quietly, almost reflexively, he straightened. Not to attention, just straighter. Calder said very quietly, "Commander." The word went off in the trauma bay like something physical. Graves, who had arrived through the main entrance 30 seconds behind Claire, stopped walking. Denny stopped writing. The 2 other nurses in the bay stopped what they were doing and looked at the flight crew looking at the woman they had spent 8 months calling Whitmore and assuming they understood. Claire's face was very still. "He's tensioning," she said. The word commander had no visible effect on her whatsoever. "We need to decompress the right side, now." She moved to the patient's right, snapped on gloves, and held out her hand. The young sailor, the one who had straightened, put a 14-gauge needle in it without being asked. He already knew the size. He had watched this exact movement happen before, in a different place, with different light and different noise, and his hands moved on muscle memory. "You can't... Whitmore, you don't have the standing to perform." Graves was crossing the room, his voice hard. Claire inserted the needle into the second intercostal space, mid-clavicular line, and the tension released, the audible hiss of trapped air decompressing, and Webb's oxygen saturation ticked upward on the portable monitor in Calder's hands. The room was very quiet. "He needs a chest tube on the right, suction on the secondary frag wounds, and someone needs to look at what's happening in the posterior thoracic. The exit pattern on the shoulder suggests the fragmentation may have tracked." She said it without looking up from the patient, her hands already moving to the next thing. "He's going to need imaging before we can rule out anything hitting the spine." Graves stopped 2 feet away from her. Something in his face had changed, not the calculating look. Something older and more careful, like a man who has just realized the ground beneath him is a different material than he thought. "What is your name?" he said. Not like a question, like a man trying to confirm a suspicion. Claire finally looked at him. "Tonight," she said, "I'm the nurse keeping your patient alive." On the monitor, Webb's vitals stabilized. Still critical, still fragile, but no longer in immediate freefall. Calder moved to his other side and began working, and the young sailor worked beside Claire with that same quiet competence, and the trauma bay reorganized itself around this new center of gravity without anyone explicitly deciding to let it happen. Outside, the storm hit the building broadside with a sound like the world shifting on its axis. And in the doorway of Trauma Bay 1, Dr. Nolan Graves stood very still, watching the woman he had shoved into a concrete wall 2 weeks ago run his department with the hands of someone who had done this 1,000 times before, in places that didn't have walls, in light that came from fire, in conditions that made Harlan County General look like a spa. And he watched her, and something moved behind his eyes that was not anger and was not surprise. It was recognition, and it was fear. He took 2 slow steps backward, out of the frame of the doorway, into the corridor. His hand went to his pocket. His fingers found his phone. He took 2 slow steps backward, out of the frame of the doorway, into the corridor. His hand went to his pocket. His fingers found his phone, and nobody in Trauma Bay 1 saw him dial. The storm outside was not getting better. It had settled in over the valley with the particular stubbornness of mountain weather. The kind that didn't move through. It just sat on you, pressing down, and you waited it out or you didn't. Rain hit the exterior windows in sheets. Somewhere above the emergency department, something loose on the roof was banging in a slow, irregular rhythm that nobody had gotten around to fixing since September. Inside Trauma Bay 1, none of that mattered. Claire worked the way she had trained herself not to work in front of people, without hesitation, without narration, without the small performative delays she had built into her daily routine to make herself look like someone who needed a moment to think before acting. She didn't need a moment. She had never needed a moment. The moments were theater, and right now there was no audience worth performing for. Webb's right lung was partially collapsed. The needle decompression had bought them time, but not the destination. And she told Denny to get a chest tube tray ready, and she told the younger sailor, his name tape said OK4, to hold the portable light steady and stop apologizing for his hands shaking, because his hands were not actually shaking, he just thought they were. "They're not shaking," she said, not looking up. "Yes, ma'am," Okafor said. And then, very quietly, because he was 23 years old and had spent the last 4 hours in a helicopter in a storm, watching his chief deteriorate, and had not been sure until about 6 minutes ago that they were going to make it to anywhere in time, he said, "It's really good to see you." She didn't answer that. She inserted the chest tube with a clean, practiced motion. No fumbling, no second pass. And connected the drainage system, and watched the fluid level, and the numbers on the monitor did what she needed them to do. Calder had taken the secondary fragmentation wounds and was working methodically, irrigating and packing, assessing depth. She was good. Claire had registered that in the first 30 seconds. Flight nurses who came in on birds like that in weather like this were not accidents of scheduling. They were the ones who didn't break when everything else did. "Posterior frag tract," Claire said to her. "What are you seeing?" "One fragment possibly sitting against the T4 vertebral body. I can't tell depth without imaging." His sensation? Diminished in the left hand. Could be positional, could be pressure. That was the sentence that mattered. Claire held it for half a second, not visibly, just internally, in that place where she kept the things that required a different kind of attention. And then she said, "Get me CT pre-clearance. I need him in the scanner before we do anything else with that shoulder." Denny said, "Dr. Graves should probably—" "Dr. Graves can make that call when he comes back into this bay," Claire said. "Until then, I'm making it. Get the clearance." Denny looked at Calder. Calder looked at Claire. Something passed between them in that look. The two women assessing each other across the body of the patient, one of them knowing exactly who she was dealing with, the other one putting the last pieces together. And then Calder nodded, once, and Denny went to get the clearance. It took 11 minutes to move Webb to imaging and back. 11 minutes during which Claire was aware of Graves' absence the way you were aware of a sound that had stopped. Not with relief exactly, but with a specific alertness. He should have come back. He had been in the corridor. The bay was active, the patient was critical, and the trauma director had simply not returned, and nobody had said anything about it because the department was running, and the person running it did not look like she needed anything from him. The CT images came back. Claire stood at the workstation and looked at them with Calder beside her and the radiologist on the phone, a man named Dr. Hollis, who worked remotely from a reading center in Charleston and sounded like he had been woken up recently and had not yet forgiven anyone for it. "Fragment is sitting lateral to T4, Hollis said. "No canal compromise. You've got clearance margins, but it's close. I'd want a neurosurgery consult before anyone touches that." "Agreed," Claire said. "What's the vascular picture?" "Subclavion's intact. You've got some hemorrhage in the soft tissue posterior to the clavicle, but nothing arterial. The shoulder joint itself it's a mess, honestly. Whoever stitches that back together is going to need a long afternoon." "Thank you, Dr. Hollis." She ended the call and looked at the images for another moment. Just her and the blue-white light of the CT workstation and the detailed map of everything that had gone wrong inside a man she had known for 12 years. Marcus Webb had been her instructor before he was her colleague, and her colleague before he was her friend. And those categories had rearranged themselves over the years in ways that were complicated and not always comfortable. The way relationships got when you spent enough time in enough bad situations with someone. She had left without telling him. She had left without telling any of them. She had made the decision in a week, alone, in a temporary housing unit at a base she was already preparing to disappear from, and she had calculated that clean was better than explained and distance was better than goodbye. Looking at his chest CT at 1:47 in the morning in Callaway Creek, West Virginia, she was not sure she had been right about that. She was not sure about a lot of things, and she filed that fact away in the same place she filed the image of Graves' hand going to his phone in the corridor, because now was not the time for either of them. She went back to the bay. Webb was awake. Not fully. He was in that particular liminal state that serious blood loss and pain medication and the body's own protective mechanisms created, where the eyes were open and tracking, but the face had a floating, unmoored quality. He was looking at the ceiling when she came in. Then he moved his eyes to her, and they focused, and she watched it happen. The slow assembly of recognition, like a photograph developing in real time. "Huh," he said. His voice was rough, dry. "That's a thing. Don't try to sit up." Wasn't going to. He wasn't. His body had given him an accurate report of its own situation, and he was respecting it. That was Webb. Even half-conscious, he had always been practical about what his body was telling him. How bad? "You'll keep the arm. The fragment near your spine isn't compromising the canal. You're going to need surgery on the shoulder and possibly a procedure for the fragment depending on how it behaves." That's actually better than I expected." He tried to pull in a deeper breath and stopped at the resistance. "Chest tube?" "Right side." "Yeah, that tracks." He was quiet for a moment. His eyes moved around the room, taking inventory, that automatic tactical habit that never fully went away. And then they came back to her. "You look like a nurse." "I am a nurse." "You're wearing scrubs. That's not the same thing." She said nothing. He said, "We've been trying to find you for 14 months. "I know." "I told them you were fine, that you'd gone somewhere you needed to go and you'd surface when you were ready." He paused. "The other guys thought I was being optimistic." "You were." The corner of his mouth did something that was almost a smile. "And yet here you are." "Here I am." She adjusted the drainage unit and checked his IV line without looking at his face. "Who else knows you're here?" "My team knows I was being transported. They don't know to where. The bird got diverted from Morgantown because of the weather." He watched her hands. "Why?" "I'm asking because the man who runs this department stepped into the corridor approximately 40 minutes ago and made a phone call, and he hasn't come back." Webb's eyes sharpened. Pain and blood loss and medication, and his eyes still sharpened like that. She had always found it remarkable. "Tell me about that man." "Later. Right now I need you to rest and I need to talk to your flight crew." "Claire." She looked at him. "Whatever you walked away from, that's still going to be here when you're done pretending it isn't." She held his gaze for a moment. Then she said, "I know," and went to find Calder. The flight nurse was in the small family consultation room adjacent to the bay, which was currently empty of family and being used as a staging area for the medical equipment they'd offloaded from the helicopter. She was repacking her trauma bag with the focused efficiency of someone who needed to be doing something physical while her brain worked through something else. She looked up when Claire came in. "How's the SAT?" Calder asked. 94 and holding." Claire closed the door behind her. "I need to ask you something, and I need the real answer, not the official one." Calder stopped repacking. "Okay, how did he get shot?" Calder's hands went still on the trauma bag. She had green eyes, dark circles under them, and the look of someone who had been running on adrenaline for so long that the adrenaline had started to feel like a normal state. Officially, it was a training incident that went wrong. And unofficially? Unofficially, she looked at the door, then back at Claire. He was specifically targeted. 2 rounds, then a fragmentation device. That's not an accident and it's not friendly fire. Someone knew where he was going to be. Claire let that settle. When? 31 hours ago. The unit tried to handle it internally for the first 18 hours. When he deteriorated, they escalated. The bird was sent because the regular air assets were already spoken for. Calder paused. There's a federal investigator who's been tracking a series of incidents targeting SOCOM personnel over the past 8 months. I don't know the details. I just know that Webb was the 4th. 4. Claire kept her face even. What were the other 3? 2 dead, 1 missing. Calder said it the way military medical people said things like that. Not without feeling, but with the feeling managed, pushed to a register that let you keep functioning. The investigator's name is Braddock. She's been trying to build a case. 8 months. Claire had been in Callaway Creek for 8 months. She was quiet long enough that Calder said carefully, "Commander? Don't call me that here." "Sorry, but you see what I'm saying?" "I see it." She looked at the wall, at a motivational poster someone had put up years ago that said, "Healing happens here," in block letters with a sunrise behind them. It was slightly crooked. It had probably been slightly crooked for years, and nobody had bothered to fix it. Who knows, the bird ended up here. Okafor filed the divert with Morgantown Approach Control. That's standard. After that, Calder shook her head. "I don't know who else might have access to that routing information." Claire nodded slowly. She was building a map in her head, the kind she used to build in briefings. Who knew what, when they knew it, what they could do with it? The map had some pieces she recognized and some she didn't, and the pieces she didn't were the ones that worried her. She went back out into the department. Graves was still not in the bay. She found Gerald Fitch, the hospital administrator, in the corridor outside the nursing station at 2:15 in the morning, which was unusual enough to register. Fitch didn't come in at 2 a.m. for minor situations. He was standing with his arms folded over his chest and his phone in his hand, and when he saw Claire, he straightened in the particular way of a man who had decided something before you walked in. "Ms. Whitmore," he said, "can I speak with you in my office?" "The patient in Bay 1 is still critical. Dr. Sorrell can manage for a few minutes." He gestured toward the corridor. "Please." She considered him, the posture, the hour, the phone in his hand, and she went with him, because the alternative was refusing, and she wasn't ready to refuse yet. Fitch's office was a small room that smelled of old coffee and carpet cleaner, and the particular bureaucratic anxiety of a man who had spent 20 years avoiding anything that might force a real decision. He sat down behind his desk. He didn't offer her a chair, but she took one anyway, because she had found over the years that sitting when someone expected you to stand changed the nature of most conversations. "Dr. Graves has raised some concerns," Fitch said. "About tonight's patient care? About your background." He put his hands flat on the desk. "Specifically, the interventions you performed in the trauma bay. There are liability questions when nurses—" "The patient is alive," Claire said. "If you want to discuss liability, you should know that I hold active emergency trauma certifications through the Naval Medical Center that authorize field-equivalent interventions during emergencies involving active or retired service members. The federal statute that covers that authorization has been in effect since 2019. She said it the way you said things you had memorized because they were load-bearing facts, not because you were showing off. If Dr. Graves wants to challenge my authority to perform those interventions, he can file a formal complaint. I'll have documentation to him within 48 hours. Fitch blinked. "I wasn't aware you had military certifications." "They're not on my travel nursing profile because they're not relevant to standard civilian practice." She looked at him. "They were relevant tonight." There was a silence in which Fitch was clearly recalculating something, and Claire let it run, because she had learned that the most effective thing in a conversation like this was to stop talking and let the other person's own thinking do the work. He said finally, "Dr. Graves has been with us for 6 years. I know. He's an important part of this department. I know that too. I hope you're not suggesting—" "I'm not suggesting anything, Mr. Fitch. You asked me to come to your office at 2 in the morning, and I came. I've answered your questions. I'd like to go back to my patient now." She stood. He didn't stop her. She was at the door when he said, "Ms. Whitmore," and she turned, and his face had settled into something that was not the administrator's professional blankness, but something more tired and more genuine, like a man who had been carrying something and was suddenly aware of how long he'd been carrying it. "Is the patient going to be all right?" "If nothing else goes wrong," she said. "Yes." She went back to the bay. At 2:40 in the morning, Marisol found her at the nursing station and pressed a cup of coffee into her hands without saying anything. It was bad coffee. The machine in the break room had been producing bad coffee since at least March. But it was hot, and Claire wrapped both hands around it and looked at the monitors at the station and let herself breathe for a minute. "Graves hasn't come back," Marisol said. "I noticed." "That's not—" Marisol hesitated. "He doesn't leave mid-shift, not unless there's a reason. People get sick. He didn't call in. He didn't tell anyone. He just—" She made a gesture. "Gone. Denny asked me what to do, and I told him to call the on-call attending, which is Dr. Fenn, who is currently 40 minutes away because of the roads. Claire drank the coffee. You handled it right. I handled it the way I handle everything Graves leaves behind, which is I patch it together and don't ask questions. Marisol looked at her. You're going to tell me who you actually are at some point, right? Claire looked at the monitors. Marisol, because I have been covering for this department for 11 years, and I have seen a lot of nurses come through, and none of them have had the kind of night you're having. I'm having a normal night. You performed a pericardiocentesis technique deviation that the attending didn't catch, and you brought in a Navy medevac patient who made a sailor stand up straight just by seeing your face. Marisol's voice was not unkind. It was the voice of someone who was tired and observant and trying to understand the shape of the situation she was in. That is not a normal night. Claire set down the coffee cup. She was quiet for a moment, and Marisol waited her out with the patience of someone who had spent 11 years waiting out difficult situations. I'm still just a nurse, Claire said finally. Tonight I was also something else. After tonight, I'm just a nurse again. She looked at Marisol. Okay? Marisol looked back at her for a long moment. Then she said, okay. She picked up a chart. Bed 3's asking about his pain meds. I'll get it. She was halfway across the department when the radio on the trauma bay wall crackled. Not the EMS radio, the internal security channel. A voice she didn't recognize said, clipped and controlled, Security to ER South entrance. We have 2 unaffiliated individuals who are not responding to direction, requesting backup. Claire stopped walking. 2 unaffiliated individuals. The phrasing was specific. Not patients, not family members. Individuals who were not responding to direction. At 2:48 in the morning, in a storm that had grounded everything within 50 miles, 2 people had come to the south entrance of Harlan County General and were not doing what security told them to do. She turned and looked at the south entrance through the long window of the nursing station, and she saw them, 2 men in dark jackets that were too dry for how hard it was raining outside, which meant they hadn't been out in the rain for long, which meant they hadn't come from far, which meant they had been close and waiting. She turned back to the nursing station. Marisol, she said, and something in her voice made Marisol look up immediately. I need you to do something right now. What? Take everyone from the nurses' station back to the medication room and close the door. Don't unlock it until I come for you or until you hear from a uniformed officer with badge credentials. Not a doctor, not admin, uniformed officer. Marisol stared at her. Claire, please. The word came out harder than she intended, pressed from somewhere that didn't ask for things softly. She met Marisol's eyes. I'll explain everything, but right now I need you to move. Marisol moved. She was already talking in a low voice to the 2 nurses behind her, steering them toward the medication room with that particular authority of a woman who had been running the real operations of a department for 11 years. Claire looked at the south entrance again. The 2 men were through it now. The security guard, young, early 20s, a kid named Patton who worked the overnight shift and who Claire had talked to exactly 3 times, twice about football and once about his mother's surgery, was walking backward, hands slightly raised, talking to them. His hand was not on his radio anymore. It was on his side, where a lot of security guards kept the thing they were hoping they didn't have to use. The 2 men were big, not the gym equipment big that Graves was. A different kind of big, the kind that came from operating in spaces where you needed to be able to do things quickly and quietly and at a disadvantage. They moved the way Claire moved when she wasn't making herself move differently. She knew what they were. She had 11 seconds between seeing them and the moment they saw her, and she used 9 of those seconds to assess the space between them. The distance to the nursing station, the obstacle configuration of 2 empty gurneys and a medical cart, the flooring type, and the overhead light distribution, and the position of every other person currently visible in the department. The 10th second was for deciding. The 11th second was for moving. She came around the nursing station from the far side, which put her at an angle neither of them was watching, and she was very deliberate about her footfall. Quiet, even, no warning. And the first man's attention was still on Patton when she reached him. It was not a long engagement. Real engagements almost never were, and people who had not been in them always expected more time, more drama, more back and forth. There was none of that. There was a controlled sequence of actions executed at a speed that the man clearly had not expected from someone in scrubs. And then he was on the floor with his wrist at an angle that would prevent him from using that hand for anything purposeful for the next several minutes. The second man moved toward her immediately. He was faster than the first one, and he had learned from it, which made him more dangerous for about 4 seconds, until it became clear that he was operating on a different playbook than she was. She disarmed him. He went down. She stood in the middle of the ER with both men on the floor and her breathing slightly elevated and her hands at her sides. And she looked at Patton, who was staring at her with an expression that belonged on a much younger face. "Call it in," she said. Her voice was even. "Tell them you need law enforcement and you need Navy security from Fort Harwick. Use those exact words. Navy security from Fort Harwick." Patton fumbled his radio out. He was shaking for real, unlike Okafor earlier. What do I say happened?" "Tell them 2 individuals made an unauthorized entry and were detained by staff." She looked at the men on the floor. "And tell them to hurry." Patton called it in. Claire crouched down and went through the jacket of the first man quickly, efficiently, the way she had been taught to process a captured threat. No hesitation, no apology, just information gathering. She found what she was looking for in the inside pocket. A phone, a folded piece of paper, and a laminated card with the logo of a private military contracting firm called Vantage Meridian Group. She had never heard of Vantage Meridian Group. She unfolded the paper. There was a photograph on it. A woman in scrubs, taken from a distance, slightly blurred, the way photographs looked when they were taken with a telephoto lens through a window or from across a parking lot. The woman was carrying a chart. Her face was 3/4 turned away from the camera. It was Claire. Below the photograph was a date. The date was 5 months ago. Below the date was a single line of text. Confirmed. Asset located. Stand by for instruction. She stared at the paper. 5 months. Someone had known where she was for 5 months and had waited, and she did not yet know why they had stopped waiting tonight, but she had a number of theories and none of them were good, and the one that was rising to the top of the list, the one that connected the photograph to the men on the floor to Graves' hand going to his pocket in the corridor, was worse than the others. She stood up. Okafor was in the doorway of Trauma Bay 1, having come out at some point during the engagement, standing very still with his arms at his sides and the expression of a man who had just watched something that had reorganized several of his assumptions. "Okafor," she said. "Yes, ma'am." "Get back in with your chief. Don't leave that bay. If anyone comes in who isn't me or Calder or Dr. Sorrell, you get on the radio." "Understood." He paused. "Commander, are you—" "I'm fine. Go." He went. She looked at the paper in her hand again. Then she looked at the corridor that led to the administrative wing, toward Fitch's office, toward the place where Graves had disappeared 40 minutes ago and had not come back from. And something cold and very clear moved through her, the kind of clarity that arrived when a situation stopped being ambiguous and became instead very simple. She was not in Callaway Creek by accident. She had chosen it because it was small and it was remote, and it was the kind of place where someone who wanted to disappear could disappear. She had calculated carefully. She had been careful for 8 months. And someone, somewhere, had been more careful than she was. Her phone was in her scrubs pocket. She had carried it for 8 months and made almost no personal calls on it, just logistics, pharmacy, staffing, the occasional text to a landlord. She took it out now and looked at the screen, and she did something she had not done in 3 years. She opened a contact that was stored under the name Swyka Moore, which was not a person's name but a code, and she typed a message that was 11 characters long, and she sent it. Then she put the phone back in her pocket and looked at the 2 men on the floor and waited for the world to start moving faster because it was about to. The storm outside hit the building again, harder, and somewhere on the roof, that loose piece of metal banged twice in the wind and went quiet. From down the corridor, very faint through the administrative wing's heavy doors, she heard the sound of a door closing, and then footsteps, coming this way, and they were not Graves' footsteps, and they were not Fitch's footsteps, and they were moving with the kind of deliberate, unhurried pace that meant the person making them had already decided they had all the time they needed. The footsteps came at a measured pace, unhurried, which was worse than running would have been. Running meant panic. That pace meant confidence, and confidence in a situation like this came from one of 2 sources: authority or certainty of outcome. And the person walking toward her from the administrative corridor had not identified themselves as either. Claire didn't move from where she was standing. She kept both men on the floor in her peripheral vision. One was still, One was beginning to stir. Neither was in a position to do anything useful. And she kept her weight distributed and her hands loose, and she watched the corridor. The door from the administrative wing opened. The woman who came through it was in her mid-40s, short hair the color of iron filings, a dark suit that was rumpled from travel rather than from the hour. She was carrying a federal badge wallet in her left hand, already open, and she held it up before she said anything else, which was the move of someone who understood that the situation on the other side of that door might involve people who needed to see credentials before they were willing to listen to words. Special Agent Dana Braddock, Naval Criminal Investigative Service. She looked at the two men on the floor. She looked at Claire. She took in both things with an economy of expression that suggested she had walked into rooms containing worse and more confusing configurations. "Are you injured?" "No," Claire said. "Is the patient in Bay 1 stable?" "Last check, yes." Braddock nodded. She came the rest of the way into the department, letting the administrative door swing shut behind her, and crouched beside the first man and looked at his face with the focused attention of someone confirming an identification rather than discovering a stranger. "I know him," she said. Not surprised. Something more like tired. "Vantage Meridian Group," Claire said. Braddock looked up sharply. "Found their laminate in his pocket." Claire held up the card. "Along with a photograph of me, 5 months old." Braddock stood. She came and took the card and the paper from Claire's hand and looked at them, and her face did something controlled and complicated that was mostly about containment. "How long have you been at this hospital?" 8 months. And you had no idea you'd been located?" "No." Braddock folded the paper carefully and put it and the card in her inside jacket pocket. "Your Sycamore message came through 12 minutes ago. I was already in the building." Claire processed that. "You were already here?" "I've been in Callaway Creek for 6 days." She said it the way you said something you wished you'd handled differently, but couldn't change now. "I was building a case. I needed clean evidence before I could approach you, because anything I did that looked like contact could have triggered exactly what just happened, only earlier, and without you knowing it was coming." 6 days. Braddock had been in this town for 6 days, and Claire had moved through her routines without any knowledge of it. And the tightness that produced in her chest was not entirely rational, but it was there. "Webb," she said, "you know about the other 3. Webb makes 4. I've been tracking Vantage Meridian for 14 months. Braddock's jaw moved. "They've been contracted to identify and eliminate members of a specific SOCOM unit, yours." The word yours landed with weight. Claire had spent 3 years trying to make yours not apply to anything anymore. "Why?" "Because 4 years ago, your unit documented evidence of a defense contractor illegally arming a non-state actor in the Caucasus region. The contractor buried it. The unit's after-action reports were classified and then redacted further than they should have been, and 2 of the people in the chain of command who could have been embarrassed by full disclosure are currently in positions where they'd prefer that documentation stay buried." Braddock looked at her steadily. "You were the unit's senior medical officer. Your field reports were the ones that were most complete, most specific, most usable in a federal prosecution." Claire was quiet. "They needed to know if you'd retained copies," Braddock said, "and then they needed to ensure you couldn't testify." The overhead fluorescent light in the corridor buzzed softly. Somewhere in the department, a monitor alarmed briefly and then reset. The storm pushed against the windows with a sound like breath. "The photograph," Claire said. 5 months ago. If they'd had me located for 5 months, they were waiting for authorization. The network has a hierarchy, and the order to move on you required sign-off above the field level." Braddock paused. "That sign-off came through 11 days ago. I found out 8 days ago. I moved as fast as I could." "And Graves?" Braddock's expression answered the question before she did. "Dr. Nolan Graves has received 4 payments from a Vantage Meridian subsidiary in the last 6 months. The payments were formatted as consulting fees. He was recruited before you arrived. We believe Vantage Meridian placed him as a contact at multiple rural hospitals in a geographic corridor, waiting." She stopped. "He didn't know your specific identity when you applied here. He found out approximately 3 months into your posting when he got a closer look at your certifications database." 3 months. He had known for 5 months. All the training sessions, all the bruises on nurses who had nothing to do with any of this, because that was just who he was regardless of who was paying him. The intersection of his cruelty and his usefulness to them was something Claire had not fully calculated, and she filed the anger that produced somewhere deep and load-bearing. "Where is he now?" she asked. "That," Braddock said, "is currently my primary problem." From Bay 1, Calder appeared in the doorway. She took in the scene, Braddock's badge, the men on the floor, Claire's posture, with the rapid assessment of someone who had been half expecting the next complication and was just finding out its specific shape. "What do you need?" she said to Claire. "Webb needs to be moved, somewhere in this building that isn't the ER. Second floor has a trauma step-down unit," Calder said. "I passed it coming in. Get Denny and Okafor and move him. Tell Denny the authorization comes from Agent Braddock." She looked at Braddock. "That's acceptable?" "Fully," Braddock said. Calder disappeared. Claire heard her voice and Denny's voice and Okafor's voice, overlapping and efficient, and the sound of a gurney moving. The man on the floor, the one who had been stirring, made a more deliberate movement, trying to shift his weight. Claire stepped on the wrist she'd bent earlier, not hard, just with enough pressure to communicate that she was aware of him and would be making decisions faster than he would. He went still again. Braddock called for backup on her radio. Terse, factual, the kind of law enforcement communication that conveyed the necessary information without providing anything that could be misused. 2 more federal agents were in the building. They came through the south entrance 90 seconds later and took custody of both men with a professional efficiency that finally allowed Claire to step back. Patton, still at his security post near the entrance, looked at her with the expression of a man who had been completely recalibrated in a single night and was still in the process of understanding what his new settings were. She walked back to the nursing station. She picked up her coffee cup. The coffee was cold. She drank it anyway because she was tired and her hands were doing a fine tremor that had nothing to do with fear and everything to do with the adrenaline metabolite that was working its way out of her system. She was human. Her body had a response protocol and it was running it. Marisol came out of the medication room 6 minutes after Claire texted her, behind her, and she looked at the south entrance where the federal agents were, and she looked at Claire, and she said nothing for a moment. Then she said, "I need a very large amount of more information." "Later," Claire said. "Is everyone okay?" "We're fine. Marisol stopped. She looked at Claire's hands, at the slight tremor. She reached over and took the empty coffee cup and replaced it with a full one from the break room machine, which she must have made while she was in the medication room because it was hot. "Later," Marisol agreed. The 3rd hour of the worst shift Harlan County General had moved forward. Braddock worked the south entrance area while her agents processed the 2 captives, and Claire checked on the department's remaining patients. The tableau procedure patient, the laceration, the second chest pain rule-out that had been almost completely ignored during the last 90 minutes. And she did it with the same surface-level steadiness she always projected, because the patients didn't need her fear, and the department needed someone moving through it like things were being handled. Things were being handled, mostly. At 3:22 a.m., Braddock appeared at the nursing station. Graves' car is still in the staff parking lot. He didn't leave by vehicle. "There's a maintenance corridor on the north side," Claire said. "Connects the hospital to the physical plant. From there you can get to the service road." "We're checking it," Braddock lowered her voice. "The men we detained, they're being processed, but they're not going to talk readily. Whatever Vantage Meridian uses for field discipline, it works. We have the laminate and the photograph, which is enough for the federal warrant, but Graves is the link between the network and this hospital. I need him." "I understand. If he contacts you, he won't contact me. I'm the problem he was paid to solve." Claire looked at her. "He'll run. He has resources, the consulting fees, whatever else they paid him. He has options." "I know. I've got his financials flagged and I've got an alert on his passport, but if he has alternate documents, he might." Claire thought about the way Graves had looked in the corridor, the calculation in his face when he'd seen what she could do. He hadn't been surprised, not completely. He'd been recalculating, which meant he had contingencies. Men like Graves always had contingencies, not because they were brilliant, but because they were the kind of selfish that made advanced planning instinctive. "Check the name Holloway," she said. "If he has an alias, it'll be something that doesn't require complete reinvention, something adjacent to who he is." Braddock looked at her. "Why Holloway?" "His mother's maiden name. It's on his hospital bio." A beat. How do you know what's on his hospital bio? I read everything when I got here, Claire said. I read everything everywhere I go. Braddock held her gaze for a moment, then got on her radio. 3 minutes later, one of the agents at the south entrance raised his voice enough that Claire could hear him across the department. Agent Braddock, we got a Holloway at West Virginia motor vehicle, license issued 14 months ago, address in Wheeling. The corners of Braddock's mouth moved in something that wasn't quite satisfaction but was adjacent to it. She crossed the department fast, issuing instructions into her radio, and Claire watched her go. Webb's transfer to the step-down unit had been completed. Okafor had stayed with him. Calder came back down to the ER at 3:35 and found Claire at the nursing station doing the documentation she had fallen behind on during the engagement, charting everything in the precise clinical language that would hold up to scrutiny: times, observations, interventions, rationale. He's asking for you, Calder said. I know. I'll go up in a few minutes. He's also asking about what's happening down here. Patton apparently told someone who told Okafor, and Okafor told Webb. Immediately, Calder leaned against the station. She was past the adrenaline phase and into the flatness that came after it, the way long-haul medical personnel looked when the situation had stabilized, but the body hadn't fully accepted that yet. Can I ask you something? You can ask. Why here? Of all the places. Claire thought about how to answer that. She looked at the emergency department, the fluorescent lights, the stained ceiling tile above Bay 2 that maintenance had promised to fix 3 times, Marisol's handwriting on the assignment board in green marker because the black ones kept running out. She thought about the 11 months she had spent choosing this place, mapping the geography, calculating the distance from anything that might find her. It was supposed to be far enough, she said, but it wasn't. No. Calder was quiet for a moment. Webb said, before we left, the last coherent thing he said before he deteriorated. He said you were the best trauma medic he'd ever worked with. And he'd worked with a lot. Claire didn't say anything. He also said you had a habit of making decisions alone that should have been made with people who cared about you. He's not wrong, Claire said, and went back to charting. At 3:51 a.m., the radio from the south entrance crackled with something that wasn't communications. It was the specific broken signal burst that meant an agent's radio had been dropped or damaged. Then silence. Then one of the agent's voices, elevated above professional baseline. Braddock, North Corridor, we've got movement. Claire was off the stool before the sentence finished. She went through the east wing access door and into the connecting corridor, and the fluorescent lights in that section were on their overnight dim cycle, half power, which turned the corridor into a landscape of gray and shadow. She heard the agents before she saw them. 2 of them, moving fast, someone saying hold, in the clipped way that meant they had a visual on something. She came around the maintenance junction corner and saw Graves. He was at the far end of the north corridor, 30 meters out, moving toward the service access door with the focused urgency of a man who had made his calculations and committed to them. I was in street clothes. He had changed, which meant he had planned for this, which meant he had kept a bag somewhere in the hospital, probably in his office, probably for months. His jacket was dark. He had a bag over one shoulder. One of the agents was in a position to intercept him at the service door if Graves didn't alter his route. Braddock was behind Claire, coming up fast through the east wing. The geometry was almost correct. Almost. Graves reached the service door 5 seconds ahead of the agent's intercept position, hit the crash bar, and the door opened outward into the storm. The agent went through after him. Claire was already moving. The service exit opened onto the maintenance yard. A concrete pad, 3 large HVAC units, a row of utility vehicles under a corrugated metal shelter. The rain was hitting nearly horizontal. In 30 seconds outside without cover, you were soaked. In 60, you were losing fine motor function in your hands depending on the temperature, and it was 41 degrees in Callaway Creek at 3:52 in the morning. The floodlight on the maintenance building was working. The one on the utility vehicle shelter was not. Graves was at the shelter, making for the vehicles, she registered, which meant either he had keys or he knew how to hotwire, and neither of those was good. The agent who had followed him through the door was Reyes. She had caught his name from Braddock's earlier radio traffic, and he was good. He was covering the distance fast, but Graves had a head start and was moving with a desperation that translated to speed, and he reached the shelter's shadow just before Reyes could close. Claire went left, around the HVAC units, cutting an angle. It was dark, and it was raining, and the concrete was slick, and she went down on one knee at the corner of the second HVAC unit, caught herself on both hands, came back up with her palms scraped and her knee sending a signal she was not currently processing. She came out of the angle, and she was between Graves and the utility vehicles. He saw her. He stopped. For a moment, the three of them, Graves, Claire, Reyes coming up behind, were suspended in the rain and the bad light, and Graves looked at her with an expression that was not the calculation she was used to, and not the contempt he'd used to paper over whatever he actually was. It was something rawer than either of those. Something that recognized, finally, that he had miscalculated in a fundamental way that was not going to be corrected. "Move," he said. "No." "Whitmore, get out of my—" "Graves." She said his name the way she'd said things in briefings, not to start a conversation, but to end one. "There's a federal agent 6 meters behind you. There are 2 more coming through the east wing door in approximately 40 seconds. Your car is in the lot and they have the plates. The alias is already flagged." She let that settle for a beat. "You don't have anywhere to go." The rain came down. Graves looked at her for another second, and something shifted in his face, and she recognized what was coming because she had seen it before, in people who were cornered and had run out of options and switched from rational assessment to something more animal. He moved toward her. Reyes hit him from behind before he covered half the distance. It was not graceful. It was wet concrete and desperation, and a federal agent doing his job with the kind of controlled aggression that got people pinned to the ground without unnecessary damage. Graves went down. He was shouting, not words, just sound. The particular sound of a man who had believed in his own impunity for so long that its removal felt like a physical wound. Claire stood in the rain and watched Reyes work the restraints, and she let the cold get into her hands and her shoulders because she had earned that, and she breathed. Braddock came through the exit door behind her. She took one look at Graves on the concrete and then looked at Claire and said, "You need to get inside. You're not wearing a jacket." "I'm fine." "You're soaking wet in 40-degree weather." "I've been in worse." "I believe you," Braddock said, not unkindly. "Get inside anyway." Claire went inside. The east wing corridor was warm and bright and smelled of industrial cleaner, and she stood just inside the door and let the temperature differential hit her system. She was shivering slightly, which was normal and expected and would resolve once she was dry and out of the draft. She was also aware of a low-grade pain in her right knee from the concrete and a burning in both palms that meant the scrapes were more than superficial. She was not thinking about those things particularly. She was thinking about the photograph in Graves's jacket pocket. Not the one he'd been shown of her, but the one she'd seen in his office 3 months ago when she'd dropped off a document and he'd been on the phone with his back turned, and she'd seen the family photo on his desk. Wife, 2 kids, a dog, a house that looked like Connecticut, or maybe upstate New York somewhere. She had thought nothing of it at the time. She thought about it now. It didn't change what he'd done. It never did. It just added the specific human weight of it, the part where cruelty and corruption and domestic normalcy all lived in the same person and found ways to coexist. And you could think about that for a very long time and not arrive anywhere useful. She went back to the emergency department. Marisol handed her a towel from the supply cart without comment. Claire dried her hands, saw the scrapes, and went to the wound supply kit and cleaned them herself, which was slightly more awkward with your own hands than with someone else's, but entirely manageable. She put 2 adhesive strips on the left palm and left the right one open to air. Denny was at the nursing station. He was 26, a second-year resident, and he had spent the last 4 hours watching the architecture of his professional assumptions get restructured from the foundation up. He looked at Claire with the expression of a young doctor who had several questions and was genuinely uncertain which one to lead with. "Is it over?" he said. "The immediate part," Claire said. "The rest takes longer. Dr. Graves is in federal custody." She looked at the assignment board. "You're the senior physician in this department right now. Dr. Fenn is 40 minutes out. What do you need?" He blinked, straightened. "I should check on the step-down patient." "Yes, you should." He went. Braddock came back in at 4:20 a.m., drier than she'd been, but not dry, and she sat down at the family consultation table and put her badge wallet on the table and rubbed her face with both hands for a moment, in the way of someone who was allowing herself exactly that much before she went back to professional mode. "Graves is being transported to federal holding in Charleston," she said. "We'll have him processed by morning." "The 2 from the south entrance?" "Same. She looked at Claire. The network isn't going to collapse from tonight. Vantage Meridian has layers, and they'll start cutting personnel the moment they know the field team was captured. But we have enough for arrest warrants on 3 individuals above the field level, and with Graves' cooperation. He'll cooperate? He will, Braddock said flatly. Once his attorney explains the difference between the sentence he's looking at with cooperation and the sentence he's looking at without it. She paused. People like Graves always cooperate. They build their identities on the idea that they're special, and when they find out they're not, the next thing they reach for is a deal. Claire thought about Graves on the concrete in the rain, making that sound. Not words, just sound. What about the documentation, she said, the after-action reports? That's a separate process. NCIS will be coordinating with the JAG Corps. There'll be a formal review. Braddock looked at her directly. I'm not going to tell you it's going to be fast or that it's going to be easy, because you've been in the military and you know how these things move. I know. But it's moving. That's what I can tell you tonight. Claire nodded. She was very tired now, and the tiredness was the other kind, not the adrenaline crash, but the deeper kind. The one that came from carrying something heavy for a long time and having it shift weight without yet being fully set down. I need to check on my patient, she said. She took the stairs to the second floor rather than the elevator because she needed the time and she needed the movement. And stairs were something her body could do on autopilot while the rest of her worked on what it was working on. The step-down unit was quiet at 4:30 a.m., the monitoring sounds lower and more intermittent than the ER. The lighting reduced to the overnight level that made everything look slightly less clinical and slightly more human. Webb was in the third room. Okafor was in the chair beside the door, upright, awake, doing his job. He nodded at Claire when she came in. Webb was awake. Properly awake this time, present, alert, registering pain in the specific controlled way of someone who had enough medication to take the edge off, but had declined to have the edge taken off entirely because he wanted to be functional. His color was better. Not good. Better. Calder told me, he said when she came to the bedside. Which part? The part that happened in the ER. The part outside. He watched her face. You okay? Yes. Your hands. She looked down at the adhesive strips. I fell. On what? Concrete. He processed that. Did the concrete deserve it? The question was so specifically Webb, the exact register of dry affection he had been deploying at her for 12 years, through briefings and deployments and all the spaces between, that something in her chest did the thing it had been resisting doing for the last 4 hours. She sat down in the second chair across from Okafor, and she breathed. The fragment near your spine, she said. Neurosurgery is going to want to see you once the weather clears and we can get a consult team up from Morgantown. The shoulder surgery will probably happen at a level 1 center. You'll be transported when you're stable enough. That's not what I asked you. I know. He waited. I'm okay, she said. And then, because she was tired and because it was Webb, and because some things were true, even if you hadn't said them out loud for 3 years, I didn't think it was going to end up here. I thought I'd picked somewhere far enough off the map that it wouldn't find you. Yes. He looked at the ceiling for a moment. It's not your fault it did. I know that. Do you? She didn't answer. He didn't push it. That was the thing about Webb. He knew when to push and when to leave a space, and he had always been better at it than she was. The monitor beeped steadily. The storm outside had moved into a quieter phase, still raining but no longer theatrical about it. Through the window, the sky had a different quality. Not lighter yet, not even close, but with some imperceptible shift in the quality of the dark that her body recognized as a long time before morning, but no longer the farthest distance from it. You're not going back, he said. It wasn't a question. Back where? To hiding. She looked at the window. I don't know yet. Braddock's going to need your testimony for the prosecution. I know. And there are 4 of us now that they've targeted. The others are going to want to know what happened here. He paused. They're going to want to know you're okay. She looked at him. His face had the particular openness that serious blood loss and a long night sometimes produced. The mask that people maintained in normal circumstances, worn thinner by the body's preoccupation with more urgent things. He meant it. All of it. Tell them I'm okay, she said. Tell them yourself. She looked at the window again. The rain ran down the glass in long, irregular streams, catching the parking lot lights and turning them into something almost like movement. Downstairs, she knew, Braddock was on her phone to a federal prosecutor. Two men were in transport vehicles headed toward the nearest federal holding facility. Graves was in handcuffs in the back of an unmarked car. Marisol was doing the 4 a.m. medication round. Denny was checking vitals on the step-down wing's other two patients. Patton was at his security post, probably still slightly recalibrated, but doing his job. The hospital was functioning. The storm was easing. The morning was coming. And somewhere in the Vantage Meridian network, in an office, on a phone, at a desk where someone with a title and a budget and the specific confidence of a person who had ordered bad things and watched them happen without consequence was sitting, a report was arriving. A report about what had happened in Callaway Creek tonight, about the men who hadn't come back, about the federal agents who had, about the woman in the hospital who was supposed to be a problem that had been solved, except that she wasn't, and she wasn't gone. And she was sitting beside the bed of the man they'd tried to kill, and she had her hands in her lap and her eyes on the window, and she was thinking. And then her phone buzzed. Not the number she'd texted Sycamore from, her personal phone, a number she had not seen in 3 years, a number she would have bet was dead, burned and discarded and replaced, the way operational communications always were. She looked at the screen. One word, incoming. She was on her feet before she had made the conscious decision to stand, and she looked at Okafor and said, "Do not let anyone into this room." And she was out the door and moving down the corridor before he could answer. And her palms were hurting and her knee was hurting, and she was running anyway, back toward the stairs, because whatever incoming meant from that number at 4:38 in the morning, it was not finished, and it was not safe, and Braddock needed to know right now. She hit the stairwell door at full stride and went through it, and below her, from the first floor, she heard something she had not heard all night, the sound of the emergency generator kicking on, which meant the power had just gone out, which meant someone had cut it deliberately because the storm was down to light rain and there was no weather reason for a grid failure in the next 4 minutes. The stairwell went dark except for the emergency exit lighting, red-tinted, minimal, the kind of illumination that let you see shapes and not much else. And from below her in the stairwell, in the red-tinted dark, she heard footsteps. Not one person, not two, 3, at minimum, moving up. 3 sets of footsteps in the red-tinted dark, moving up with the deliberate spacing of people who knew the geometry of the space they were entering and had planned for it. Claire didn't go down to meet them. She went up. 1 flight to the second-floor landing, where she pushed through the stairwell door into the dim corridor and let it close behind her with a controlled click rather than a slam, because sound traveled in stairwells and she didn't need them accelerating. The emergency lighting up here was white, battery-backed, mounted at floor level. It lit the bottom half of the corridor and left the top half in shadow, which meant anyone moving through it was visible from the knees down and guessable from the rest. She moved to the nearest patient room doorway, unoccupied, dark, door standing ajar, and pressed into it and pulled the door to within 2 inches of closed and took stock. Her phone was in her pocket. She needed Braddock, but the power was out, and she didn't know what that had done to the cell signal in the building. Hospitals ran on backup systems that prioritized medical equipment, not communications infrastructure. And in a building this old and this underfunded, the backup had probably never been tested against an intentional grid cut. She tried the call anyway, pressing the phone against her ear and covering the speaker side with her palm to kill the sound. 1 ring, 2, dead air, text then. She typed fast, 1 thumb, 2nd floor, stairwell compromised, 3 incoming minimum. Power cut deliberate. She hit send and watched the progress bar, and the bar hung, loading, and then the message showed delivered, which meant the cell signal was intermittent but not gone, which was something. She put the phone away. The stairwell door opened. They came through in the trained way, first man holding the door, second and third moving past him with angles covered, then first man releasing the door and coming in behind. It was smooth, but not military smooth, more private security smooth, which was a meaningful distinction. Private security trained on controlled scenarios and repeated drills. Military trained on the possibility that the scenario was nothing like the drill. The men in the south entrance had been private security. These were the same. That was useful. There were 3 of them, as she'd counted from the sound. Dark clothing, low profile, nothing that announced itself. The first one had a radio earpiece she could see from the faint reflection of the floor lighting. The second was carrying something that wasn't a weapon, but that she identified in the same half-second as a signal jammer, a handheld unit, older model, the kind that disrupted cell and radio in a radius of about 15 meters. That explained the cell signal degradation. It also explained why Braddock's radio had gone staticky before the south entrance issue, and why the power cut had preceded them rather than accompanied them. Systematic preparation, coming in stages. Someone had planned this with more lead time than the south entrance team. This was not a reactive send. This was a parallel operation that had been running concurrent to the first, and the first had been a distraction. She let them pass the doorway. The first man went toward the step-down wing. The second and third split, one going right toward the nurse's station, one staying near the stairwell door. They were going for Webb. She had known that was the target. She had sent Okafor to guard the room, and now she was doing the math on whether one 23-year-old sailor with no firearm was going to be sufficient against a man who was paid to not stop until he'd completed the job. The answer was no. She came out of the doorway. She went for the second man first because he had the jammer, and because without it, Braddock could coordinate. And she took it from the engagement the way you took any piece of equipment from a situation where the other person didn't expect you to know what it was or why it mattered. The third man reacted faster than the second had. He was the one who had stayed near the stairwell, covering the rear, which meant he was the most experienced of the 3, and she had him on her left in the next second, and that was the 4 seconds that were not clean, that were the kind of ugly close-quarters reality that left marks regardless of outcome. She went down once. Her already damaged knee hit the floor, and the pain signal was loud, and she was back up before her body had fully registered the complaint, and the jammer was in her hand, and she put it against the wall with enough force to end its operational life. The third man grabbed her from behind. His arms came around her from above, a bear hug attempt, trying to neutralize her hands, and she let her weight drop, suddenly and completely, which was the single most reliable counter to that approach, because it turned his grip from a restraint into a deadlift, and nobody expected the person they were restraining to simply become 140 pounds of uncooperative ballast. He adjusted, had to, and the adjustment gave her the angle she needed, and then she had his arm in a position it wasn't designed for, and he released. The first man had heard it. He was coming back from the step-down wing direction. She needed this to stop now. She had the jammer. She was in a hospital corridor with 3 private security contractors and a federal agent 2 floors below her who didn't know the full picture, and she needed this to stop before it became something that affected the patients or Okafor or anyone else who hadn't signed up for this particular evening. NCIS, she called out, loud, filling the corridor with it. Federal agents in the building, drop what you have in your hands and get on the floor. It was not a deception she was proud of. It was also not entirely a deception. Braddock was in the building, 2 of her agents were in the building, and the statement that they existed was accurate. The implication that they were about to come through the stairwell door was a liberty. The first man stopped. The second man, who was on the floor and processing the situation from ground level, said something under his breath that wasn't English. The third man looked at Claire. He was the experienced one, and experienced people ran their own calculations, and his calculation was visible in his face as it happened. The jammer was down, the approach had been compromised. The federal declaration changed the legal exposure of everything that happened next, and the job he'd been sent to do was already generating complications that hadn't been in the brief. He put his hands up. It wasn't surrender in any meaningful emotional sense. It was operational math. First man followed. Second man, still on the floor, put his hands out flat, which was the floor-level version of the same thing. Claire had approximately 60 seconds before one of them revised the calculation. She went to the stairwell door and hit it open and called down, not caring about the sound anymore. Braddock, 2nd floor, 3 in custody. Silence for 2 seconds. Then Braddock's voice coming up the stairwell. Coming up. She came up with both agents behind her, and Reyes had a sidearm out, and the situation on the 2nd floor became federal jurisdiction in the 30 seconds it took them to get into position. Braddock looked at the 3 men, looked at Claire, looked at the destroyed jammer on the floor, and said nothing for a moment. Then she said, "You're bleeding." Claire looked down. Her right forearm had a cut she hadn't registered. The third man's jacket had something on the sleeve, a buckle or a snap, that had caught her skin in the grab. It It was long but shallow, leaking rather than flowing. She pressed her opposite hand against it. It's fine. You keep saying that. It keeps being true. Braddock almost smiled. Didn't quite. Get downstairs. Let Calder look at that. Webb? My agents are with him. Go. She went. Okafor was in the doorway of Webb's room when she passed it, having come out at the sound of the corridor activity with the expression of a man who had been about 30 seconds from improvising something desperate with a vital signs monitor. He looked at her arm. He looked at the corridor. He looked at her arm again. He's okay, she said, meaning Webb. So are you, Okafor said, in the tone of someone for whom this had been a genuine uncertainty for the last 4 minutes. So am I, she agreed, and kept moving. The stairwell down was still red-lit, and the generator was still the only power source, but the building had a different quality now. Not quieter exactly, but differently noisy, the sounds of a crisis that had reached its peak and was beginning the work of resolution. She could hear voices on the first floor as she descended, the coordinated activity of Braddock's team processing the evening, making calls, doing the sequential work of what happened after. Calder was at the ER nursing station, and she looked at Claire's arm without needing to be asked and said, "Sit down." "I don't need to—" "Sit down." Claire sat down. Calder cleaned and closed the laceration with steri strips. It didn't need sutures. She was right that it was shallow, but shallow cuts on forearms bled in a way that looked worse than they were, and Calder was thorough about irrigation because she was that kind of medic, the kind who did the step you could skip, because skipping it was where infections started. She worked with the focused silence of someone who was using the physical task to manage something internal. "How many was it?" she said, not looking up from the arm. 3. Same organization as the first 2? Probably. Different unit. Better prepared. Calder pressed a final strip in place. "They were here for Webb." "Yes." "And you were between them and him." "Yes." Calder looked up. Her green eyes were tired and direct. "You know you don't have to keep doing that, being between people and the thing that's coming for them." Claire looked at the nursing station, the assignment board, Marisol's green marker, the stained ceiling tile above Bay 2. "I know," she said, "but you're going to anyway." "Tonight I am." Calder accepted that. She put the irrigation supplies in the disposal bin and snapped her gloves off. "For what it's worth," she said, "Webb wasn't the only one on the bird tonight. I volunteered for this run. When they told me who was at the destination, I volunteered." Claire looked at her. "We all would have," Calder said. "Every person from the unit, the extended unit, anyone who ever trained with you or worked with you. It wasn't just him looking for 3 years." She paused. "I want you to know that." The thing in Claire's chest that had been resisting all night did something again, and she breathed through it, and she said, "Thank you," which was not adequate, but was what she had. The power came back at 5:08 a.m. Not all at once. It came in sections, the way power returned after outages in old buildings, room by room and corridor by corridor, until the hospital was fully lit again and the HVAC came back online with its low background hum, and the monitoring systems completed their restart cycles, and the ER looked like an emergency department again rather than a disaster scene. Braddock came to the nursing station at 5:20 with a tablet in her hands and the look of someone who had been on the phone with multiple federal offices in the last hour and had received enough information to significantly change her understanding of the situation. "Sit down," Claire said. Braddock sat, which suggested she was more tired than she was showing. She put the tablet on the desk between them. 5 individuals are now in federal custody related to tonight's events, she said. 3 from the second floor, 2 from the south entrance. Graves is in Charleston processing. We've also executed arrest warrants on 2 Vantage Meridian executives in the last 2 hours. Those were already in motion. Tonight accelerated the timeline. She looked at Claire. The network is contracting. When an operation this size starts making arrests, the upper levels start making decisions about what to cut, and what they're cutting right now is everyone below the 3rd tier of the hierarchy. Which means they'll survive. The top of the structure, yes. For now. Braddock's voice had a flatness that was not defeat but was not comfort either. These things take the time they take. I know that's not what you want to hear. It's accurate, that's enough. Braddock looked at her for a moment. The message you received. The word incoming. Yes. That number. Can you tell me whose it was? Claire had been thinking about that since the stairwell. The number was 3 years dead, which meant someone had resurrected it, which meant one of two things. Either someone in her former unit had maintained the channel as a contingency, or Vantage Meridian had it and had used it to spook her deliberately, to get her moving, to get her away from Webb. She had been over both possibilities while Calder was closing her arm, and she had not arrived at a certain answer, which meant she needed to be careful about what she told Braddock. I don't know, she said. I'll find out. Braddock accepted this in the way of a federal investigator who knew the difference between a lie and an answer that was being withheld for legitimate reasons. When you do, she said, I'd appreciate knowing. You'll know. At 6:15 a.m., Marisol finished the overnight documentation and stood up from the nursing station chair and stretched in the specific way of someone who had been sitting in a state of managed alertness for hours and was now allowing her body to remember that it was tired. She looked at Claire. The part where you explain everything, she said. Yes. Is that still happening? Yes, not tonight. Tonight's over. This morning, Claire amended. Marisol nodded. She did not look hurt or impatient. She looked like a woman who had decided that the shape of the situation was stranger than she'd thought, and was making room for that without requiring an immediate accounting. That was Marisol. 11 years in this department had given her a relationship with the unpredictable that most people never developed. The young sailor upstairs, she said. Okafor. He came down to get more saline for the drip. He's 23. Yes. He looks at you like... Marisol paused, choosing the word. Like you're someone he was told about before he ever met you. Claire looked at the assignment board. I was his instructor. A long time ago. How long ago? He was 17, JROTC program, summer medical track. I ran the advanced session 1 year. She had not thought about that in a long time. The summer session, the 17 and 18-year-olds who wanted to be military medics and didn't yet know what that meant. The ones she'd watched carefully for who had the combination of intellectual rigor and emotional regulation that the job actually required. Okafor had been remarkable. She had written a letter for him, one she hadn't signed with her actual name because she'd already been planning to disappear. He became a sailor, Marisol said. He became a good one, apparently. Marisol looked at her for a moment. You've been leaving things behind you, she said, and they keep turning into something. It was not a criticism. It was an observation delivered with the gentleness of someone who understood that this was both a gift and a weight, and that it didn't resolve easily. I know, Claire said. The federal evidence team arrived at 7:40 a.m. 4 technicians with equipment cases, coordinating with Braddock on the processing of the scenes in the ER, the south entrance, the second-floor corridor, and the administrative wing. They moved with the methodical efficiency of people who had learned to work quickly in spaces that needed to return to operational function, and Braddock had clearly briefed them on the hospital context because they stayed out of patient areas and cleared their equipment through the nursing station before positioning. One of the technicians asked Claire to walk him through the south entrance engagement for documentation purposes. She did it the way she did most things, accurately, sequentially, without editorializing. He recorded it. She signed the preliminary statement. He thanked her and went back to his work. At 8:15 a.m., the on-call attending, Dr. Fenn, arrived. A compact, methodical woman in her 50s who had been with Harlan County General for 22 years and had the unflappable quality of someone who had seen the hospital in multiple states of crisis and had developed a durable relationship with chaos. She came in through the main entrance, took one look at the federal evidence team, and walked to the nursing station where Claire was finishing the last of the overnight documentation. I heard there was a situation, Dr. Fenn said. Several, Claire said. And Dr. Graves? Is in federal custody in Charleston. Dr. Fenn absorbed this. She set her bag down on the station desk and looked at the assignment board and then at the department, doing the rapid situational assessment that experienced physicians did when they walked into rooms that had already been in motion without them. Are the patients stable? She said. All of them. Good. She looked at Claire. Then walk me through it. Claire walked her through it, the clinical parts, the patient care decisions, the medical rationale for each intervention. Dr. Fenn listened without interrupting, asking 2 precise questions at points where the clinical picture needed clarification. And when Claire finished, she was quiet for a moment. The pericardiocentesis approach deviation, she said. Yes. Graves followed your call. He saw the imaging. He made the clinical decision. Don't do that, Dr. Fenn said, not unkindly. I'm not interested in who gets credit. I'm interested in whether the right decision was made and whether it was made correctly. She paused. Was it? Yes. Good. She picked up the chart. Go home, Whitmore. You've been here since 11 o'clock last night. There's still... I'm here. Denny is here. Marisol is staying for the overlap. She said it with the finality of someone who had been making staffing decisions for 2 decades and did not negotiate on them. Go home. Claire went. Except she didn't go straight home. She went to the second floor first. Webb was awake, and Braddock was in the room with him, and the conversation they'd been having stopped when Claire came in, not in the guilty way of people discussing something secret, but in the natural pause of people who had reached a point and were willing to reorient. Braddock told me the full picture, Webb said. Most of it, Braddock said. Most of it, he agreed. He looked at Claire. His color was better than it had been at 3 in the morning. Still pale, still in the territory of a man who had lost a significant amount of blood and was operating on the first stages of recovery, but present and functional in the ways that mattered. 14 months, he said. They've been building this for 14 months. The network existed before the targeting started, Braddock said. Vantage Meridian has been operational for at least 7 years. This contract was one of several. She looked at her tablet. We have preliminary cooperation from 2 of the men detained last night. Not Graves. He's not talking yet. His attorney arrived in Charleston at 6 this morning, but the field team from the south entrance. The jammer team from the second floor is staying quiet. The south entrance team is talking because they were the lower paid tier, Claire said. Correct. They gave us the name of their direct handler, which gave us a name above that. Braddock set the tablet down. You know the name Aldrich Senna? The name landed in the room and settled. Claire did know the name, not personally. She had never met the man, but professionally, in the way you knew the names of people who existed at the edges of the operational world, in the contracting space where defense money and private services intersected. Aldrich Senna was the founder and operational director of Vantage Meridian Group. He was 61 years old, former intelligence contractor, currently headquartered in Arlington, Virginia, with a portfolio of defense service contracts that had been renewed consistently under 3 consecutive administrations. He had also, according to the file she had built in her head over the last 4 hours, just authorized a second-wave operation against a federal witness target in a West Virginia hospital, which was the kind of decision that was difficult to walk back even with the best legal team in Virginia. You have him, she said. We have enough for a warrant, Braddock said, which is different from having him. His legal resources are considerable, and his access to people who can create delay is significant. She paused. But the arrest warrant was signed at 7:45 this morning by a federal judge in the Eastern District of Virginia. 2 agents are at his Arlington office right now. The room was quiet. Webb looked at Claire. She looked at the window, different window than the one she'd watched the rain on 6 hours ago, west-facing rather than north. The mountains visible now, as the storm had finally cleared and the early morning light was hitting them at the angle that made the tree line look almost copper. There's a problem, Claire said. Braddock looked at her. The documentation, the after-action reports from the unit. She said it carefully, because she had been carrying the weight of this specific piece for 3 years, longer than any other piece. Vantage Meridian needed to know if I retained copies. They needed to eliminate the possibility before the prosecution could use them. She looked at Braddock. They assumed I had them because I was the senior medical officer, but the reports I filed were classified above my own access level after the fact. I couldn't have retained copies even if I'd tried, because the classification occurred after submission. Braddock was very still. You don't have copies. I have something else. Claire reached into her scrubs pocket and took out her phone. She opened a file application and held the screen toward Braddock. When I left, I knew what was going to happen to those reports. I had 6 days before the reclassification order came through. I spent 3 of those days in the base library. She paused. I didn't copy the reports. I memorized them. Braddock looked at the screen. On it was a document, long, dense, with technical and operational language, formatted in the style of a military after-action report. It was dated 3 years ago. At the bottom, it had the report number and the unit designation and the coordinates and the names. I've been transcribing from memory for the last 18 months, Claire said, cross-referenced against what I could verify through open sources. It's not a certified copy. It's a sworn statement of recollection. But the specific technical details, the names, the dates, the contractor identifications, the material descriptions, those are in there, and they can be verified against records that Vantage Meridian cannot reach because they don't control the sourcing. Braddock took the phone very carefully, the way you took something that was simultaneously evidence and fragile. She read for 2 minutes without speaking, her face going through several controlled transitions. "You've been sitting on this," she said. "I've been building it. For 18 months. I needed it to be accurate," Claire said. "I needed every detail to be right, because if it wasn't right, it was just a nurse's word against a defense contractor with 7 years of federal relationships. It had to be right." Braddock looked at the document for another moment. Then she looked at Claire with an expression that was not entirely professional, something behind the investigator's mask, something that was simply human and direct. "This changes the prosecution's position significantly." "I know. There will be a formal deposition process. It'll be—" "I know what it'll be," Claire said. "I'm ready for it." Webb, who had been quiet through this, made a sound that was not quite a laugh but was adjacent to one, the involuntary sound of a man who had spent 3 years worried about someone who had, it turned out, been doing something definitive about the problem, instead of simply hiding from it. "Of course you were building a case," he said. "Did you expect something else?" "From you?" He shifted against the pillow, carefully, mindful of the chest tube and the IV and the shoulder. "No, He stopped. "I thought you'd gone somewhere to heal." "I was healing," Claire said. "I was also working." He looked at her for a long moment, and the things she had said on the JROTC summer evaluation, the comment she had put in the assessment for the 17-year-old who would become Okafor, was something close to what she saw in Webb's face now. Not pride, exactly. Something more complicated than pride. The specific look of someone who knows someone well and is seeing them clearly and is glad of both facts simultaneously. "The deposition," he said. "They're going to put you in a room with people who have been trying to make you disappear for 3 years." "Yes." "And you're okay with that?" "I've been in the room with them all night," she said, physically. She picked up her phone from the bed table where Braddock had set it. "This is just the paperwork version." She said goodbye to both of them and took the stairs down. Her knee registered the descent clearly, and she let it, because ignoring it was not the same as it not being there. And she came out on the first floor and walked through the emergency department one more time. It was 8:50 a.m. The day shift was coming in. The federal evidence team was finishing up near the south entrance. Marisol was at the nursing station doing the handoff with the incoming day nurse, a woman named Prescott, who was looking at the activity level of the department with the bewilderment of someone who had arrived expecting Tuesday and found something considerably larger. Marisol caught Claire's eye as she passed. One look, brief, and Marisol gave her a small nod. Not a goodbye, not even a see you later, just an acknowledgement that something had happened and they were both still there. Claire pushed through the main entrance and out into the morning. The storm was completely gone. The valley air was cold and smelled of wet earth and pine, the particular clean that came after mountain weather, and the light was early and horizontal and gold, and the mountains on both sides of the valley were dark green above the tree line and gray-blue above that, and the sky behind them was the specific pale blue of cleared autumn weather that looked almost fragile from below. She stood on the hospital steps for a moment. Her phone buzzed, a number she recognized. Not Sycamore, not the unknown incoming number, but Braddock's direct line. She looked at the message. Sene in custody. Arlington, 8:47 a.m. Formal charges filed. You'll receive deposition scheduling within 48 hours. Get some sleep, Commander. She looked at the word commander for a moment. Braddock didn't make mistakes with language. She had used it deliberately, and Claire understood what it meant. Not just a title, but a position, a status that had been in suspension and was now resuming, not because someone had ordered it back into existence, but because the thing that had always made it true had simply been visible tonight in a place where no one was supposed to see it. She put the phone in her pocket. She started walking toward the staff lot. She was most of the way there when she saw the car, a dark sedan, parked 2 spaces from her vehicle, Engine off. Someone in the driver's seat. She stopped. She assessed. The person in the driver's seat was looking at a phone, not at her, and the angle was wrong for surveillance, and the make and model was consistent with a rental from one of the federal agencies. Then the driver's side window came down. The person looking at the phone looked up. She was a woman, late 50s, silver hair, the kind of bearing that came from a long time wearing a uniform that wasn't on anymore. She was in civilian clothes, but they sat on her the way civilian clothes sat on people who thought of them as a kind of disguise. She had a rank insignia on the lapel of her jacket, not decorative, an actual insignia, Rear Admiral. Claire stopped walking. The woman in the car looked at her for a long moment without speaking. Then she said, through the open window, "I've been waiting 2 hours. I would have come in, but Agent Braddock said you had enough complications." Claire said nothing. "My name is Vice Admiral Constance Hale," the woman said, "Naval Medical Command, and I think it's time you and I had a very different conversation than the one you've been having with everyone else tonight." The morning light was in Claire's eyes. The valley was quiet. Somewhere behind the hospital, a bird was working on something in the wet trees. "What kind of conversation?" Claire said. The Vice Admiral's expression shifted into something that was not a smile exactly, but was something that came from the same place a smile came from. A kind of resolution that had been waiting a long time for the right moment and had finally found it. "The kind where we stop pretending your file ends 3 years ago," she said. "Get in." Claire got in the car. It was warm inside, the heater running low, and it smelled of coffee from a cup in the center console that was mostly gone. The Vice Admiral did not offer her any, which was fine. Claire was past the point where coffee was going to change anything about how she felt. Hale did not start the car. She sat with her hands in her lap and looked at the hospital entrance for a moment. And then she looked at Claire, and she did it with the directness of someone who had spent a long career making assessments of people and had learned to lead with the honest version rather than the diplomatic one. "You've been in my jurisdiction for 8 months," she said. "I didn't know that until 11 days ago, when Braddock's investigation flagged a travel nurse at a West Virginia rural hospital with military certifications that matched a ghost file." "Ghost file," Claire said. "Your service record was reclassified to restricted access 3 years ago. Standard language. Medical separation, administrative closure. Except the classification level assigned to it was 2 tiers above what a routine medical separation requires." Hale's voice was even. "I've been in Naval Medical Command for 4 years. When a file comes across my desk at a classification level that requires my specific authorization to open and the contents describe someone being medically separated for reasons that don't add up to the classification level assigned, I start asking questions. And the questions I asked led me to Braddock, and Braddock led me to Callaway Creek." She picked up the coffee cup, looked at it, set it back down. "I want to be clear about something before we go further. I'm not here because of what happened last night. Though what happened last night has accelerated everything. I was already coming. The orders I carry have a date stamp from 8 days ago." Claire looked at the mountains. The light had shifted in the last 10 minutes. Less horizontal now, more direct. The valley filling up with morning instead of just the edges of it. "What orders?" "The reclassification of your file is being reversed. As of 72 hours ago, a formal review board convened, under my authority, with JAG oversight, to examine the original circumstances of your separation." Hale paused. "I'm not going to dress it up. What was done to your record was wrong. It was done by people who had interest in keeping certain operational documentation buried, and your record was collateral damage in that process. A tool used to make you look like someone who had left voluntarily and cleanly, so that if you ever surfaced with questions or testimony, the institutional response was already built in." She looked at Claire directly. "You were erased so that what you saw and documented couldn't be attached to someone credible." The word credible sat in the air of the warm car. Claire had thought about that word, in various forms, over 3 years of quiet work in rented rooms in rural hospitals. Credibility was the thing they'd taken, more than the rank or the file or the access. You could rebuild information. You could memorize reports. You couldn't easily rebuild the institutional standing that made people listen to what you remembered. "The review board's preliminary findings," Hale said, "support a full reinstatement of your service record with an amended separation date and a formal correction of the administrative record. That process requires your participation and your consent, and it will take time. I won't tell you it's fast, but it is moving." She reached to the back seat and produced a folder, the physical kind, which felt deliberate in an age when everything was on tablets and phones. She put it on the console between them. This is the preliminary finding document, not final, but substantive. Claire looked at the folder. She didn't pick it up immediately. The prosecution of Aldrich Senna and the Vantage Meridian Network, Hale continued, will be a federal criminal matter coordinated between NCIS, the Department of Justice, and the JAG Corps. Your sworn deposition, the transcribed recollections, will be entered as evidence. Braddock briefed me on the document at 8:52 this morning. A brief pause. It's thorough. It took 18 months. I believe it. Hale looked at her. It's also the kind of testimony that ends careers and changes the composition of defense contractor oversight at the federal level. I want you to understand the scale of what you've put together. I understand the scale. Good. Hale folded her hands again. Now, I have a different question, and this one is not official. This one is just me, sitting in a rental car in West Virginia at 9 in the morning, asking someone who has been carrying something enormous for 3 years a question that isn't in any procedure manual. Claire waited. How are you? Hale said. The question was simple, and it was the hardest one. Not because Claire didn't have an answer, but because the answer was not a single thing. It was layered and complicated, and some of it was not okay in ways that were not going to be fixed by a review board or a prosecution, because some of the damage was the kind that happened in the interior and took a different kind of work to address. She was aware of her knee. She was aware of the laceration on her forearm. She was aware of the specific exhaustion that came from a night in which she had been multiple things at once and had not been able to be any of them completely. I'm functional, she said, which was accurate. Hale accepted this without pushing it. Will you tell me what you want? Not what you'll accept. What you actually want. Claire looked at the folder on the console. She thought about what she had told Calder, that she had been healing and working at the same time, that the two things had been happening in parallel in the same small rented house in the same small valley town, that she had been a nurse at night and something else in the daylight hours when she sat at a second-hand desk and wrote from memory with the precision of someone who understood that the words had to be exactly right, because there would not be a second chance to get them right. She thought about the 17-year-old who had become Okafor, sitting in the chair outside Webb's room with his hands in his lap and his spine straight, doing his job, because that was what you did. She thought about Marisol at the assignment board with a green marker, and the stained ceiling tile, and the bad coffee, and 11 years of holding a department together through whatever came through the doors. I want my record corrected, she said. I want the people who built the case for erasing it to face a court that doesn't belong to them. She looked at Hale. And I want to keep doing what I was doing, the medicine, not behind a desk, working, with patients, with trainees, with people who are learning to do this under conditions that don't forgive mistakes. She paused. I want to do it without hiding what I know. Hale nodded slowly. That's manageable, she said. More than manageable. She picked up her own phone and looked at something on it briefly. Naval Medical Command has a training development program for combat medical personnel. It's been understaffed for 2 years at the senior instructor level. The people who are good enough to run the advanced trauma modules are the people who are actively deployed, which creates a structural gap. She put the phone down. The position wouldn't require you to leave civilian practice if you didn't want to. It's a hybrid designation, reserve status, senior instructor, with a formal advisory role in curriculum development. You'd be teaching the things you know to people who need to know them. Where? The primary installation is Fort Harwick, 60 miles from Callaway Creek. Claire had told Marisol she thought that was the nearest base. She had known exactly how far it was. She had calculated it in her first week in the valley. I'd need to think about it, she said. Of course. Hale said it without any performance of patience, just the straightforward acknowledgement that the answer she'd given was a reasonable one and the timeline was not urgent. You have time. The review board process will take several weeks at minimum, and the deposition schedule will need to be coordinated around that. She looked at Claire. You have more time than you've had in 3 years. Use it. Claire picked up the folder from the console. She held it without opening it for a moment, just the weight of it, which was not heavy in any physical sense, but was the heaviest thing she'd held all night. She opened it. The language was the legal and administrative language of military bureaucracy, dense and structured and not designed to be moving, but it was moving anyway. Not because the words were beautiful, but because of what they were correcting. Her name, her record number, her service dates, her rank, listed accurately and without the qualifications that had been inserted 3 years ago to make the separation look like her choice instead of a removal. Her commendations, which had been suppressed along with the rest of it. Her operational citations, which had been buried under the reclassification. She read 2 pages and closed the folder. Thank you, she said. It came out level. She had intended it to come out level. Don't thank me yet, Hale said. Thank me when the final board issues. This is preliminary. I know, I'm thanking you for the preliminary. Hale looked at her for a moment, and then she did something Claire had not expected. She reached across and put her hand briefly on Claire's arm, the one that wasn't wrapped, just for a second. Then she withdrew it and looked back at the hospital entrance with her admiral's bearing back in place. Get some sleep, she said. I'll be in contact tomorrow. Claire got out of the car. She drove home on autopilot, which was a thing her body knew how to do when her mind was somewhere else entirely. The house she rented was 8 minutes from the hospital. A 2-bedroom with 1 bedroom used as an office, and a landlord who had never once asked her a personal question, which she had selected for that specific quality. She pulled into the short gravel driveway and turned off the engine and sat for a moment. The valley was fully awake now. A neighbor's dog was doing something enthusiastic in a backyard she couldn't see. The mountain ridgeline to the east had the sharp detail that came after rainfall, every tree line distinct. The sky above it, a blue that didn't look like West Virginia's usual autumn blue. It looked like something that had been freshly made. She went inside. She put the folder on the desk in the office room, among the other materials that had accumulated there over 18 months of careful reconstruction. The documents. The cross-references. The timeline she had built on the back of a paper calendar and then photographed and saved in 3 separate places, because she was not going to let the only copy exist in a single vulnerable location. She looked at all of it for a moment. Then she went to the bathroom and looked at herself in the mirror. She looked like someone who had been working all night. The adhesive strips on her left palm, the bandaging on her right forearm, the shadows under her eyes that were beyond the kind that sleep fixed quickly, a bruise developing on her right cheekbone from the 3rd-floor engagement that she hadn't noticed in the dark. She was not the neat, pressed version of a person that institutions liked to put forward when they talked about people who had done things. She was the actual version, tired, damaged in several specific and recoverable ways, still in yesterday's scrubs, standing in a bathroom with scuffed tile and a faucet that ran slightly cold before it ran warm. She was also still standing. That was the thing she kept coming back to, not as a triumphant statement, but as a plain fact that had weight. 3 years of being erased, and 6 months of being targeted, and 1 night of being actively hunted in the building where she worked. And she was standing in her bathroom in West Virginia, and the people who had wanted her gone were in federal custody, and a vice admiral had driven 400 miles to sit in a parking lot and wait for her. She was still standing. She showered. She cleaned the scrapes and replaced the strips on her palms. She put on civilian clothes, jeans, a flannel shirt, the kind of clothing that had no institutional affiliation and made no statement. And she went to the kitchen and made coffee that was better than the hospital machine's version. And she sat at the kitchen table and drank it while the morning moved through the windows. She did not sleep yet. She was too wired for sleep, the adrenaline metabolite still running its long exit, and she had learned over years that fighting that process was less useful than occupying the time it needed. She sat with the coffee and she let her mind do what it needed to do, which was to move through the night's events in the sequential order of someone who was not panicking but who needed to process what had happened before she could file it properly. At 10:30 a.m., her phone rang. Webb. You should be resting, she said. I'm in a hospital bed. Everything I do is technically resting. His voice was stronger than it had been at 4 in the morning. Still measured, still careful about the breath behind each sentence, but present. Hale talked to you. She did. And I told her I needed to think about it. The instructor position. Yes. He was quiet for a moment. In the background, she could hear the soft background sounds of the step-down unit, monitors, low voices, the specific ambient texture of a hospital in daytime mode. Can I tell you something without you telling me it's not necessary? You can try. The summer I found out you'd gone, he said, I pulled the training files from the JROTC medical program. The ones from the summer you ran. I read every evaluation you wrote. He paused. I was looking for something. I don't know what. Some pattern in who you thought was worth investing in, because I thought if I understood that I'd understand where you'd gone. She looked at the window. The light was different now. Morning proper. Not the gold of just after sunrise, but the cleaner, more even light of midday approaching. Did you find it? I found Okafor's evaluation, the letter you wrote for his application. He paused. You wrote that he had the rarest combination in medical training, technical precision, and genuine care for the person, not just the patient, that you'd seen it maybe twice in 15 years of teaching. Another pause, shorter. He told me, after the helicopter, when we were in the air, he said he'd read that evaluation because his instructor had kept a copy and given it to him when he commissioned. He said it was why he went special operations medicine instead of standard fleet medical. He said he wanted to be the kind of medic who would earn that description. Claire was quiet. You didn't go anywhere you didn't leave something behind, Webb said. I just wanted you to know I see that. She looked at the folder on the desk through the office doorway. How's the shoulder? Hurts significantly. You'll have surgery within the week. The neurosurgery consult should be today or tomorrow, once the weather is clear for the transport. Claire. What? Take the position. She didn't answer immediately. She looked at the mountain through the kitchen window, and she thought about what Marisol had said, that she'd been leaving things behind her and they kept turning into something. That was not a coincidence, and it was not an accident, and it was not luck. It was the consequence of a certain way of moving through the world, carefully, completely, with the understanding that the work you did in any given place was going to live there after you left, in the people who had watched you do it, in the changes it had made to how they saw what was possible. She had done that in the JROTC program. She had done it in the field, in the briefings, in the field surgery courses, where she had taught the left parasternal approach to young medics who would go on to use it in places she would never see. She had done it in 8 months at Harlan County General, in the quiet accumulation of correct decisions and honest work, in the model of what it looked like to keep going even when the environment was designed to make you stop. She had been doing it her whole career. I'll think about it, she said. Webb made a sound that meant he knew what that meant, coming from her. Get some sleep. Working on it. She hung up and sat with the empty coffee cup in the morning, and she did not make the decision yet. She let it sit where Hale had put it, in the space of time that had been returned to her. And eventually, the tiredness that the adrenaline had been holding back arrived fully, and she went to the bedroom and lay down on top of the covers in her jeans and flannel shirt, and she was asleep in under 3 minutes. She slept for 7 hours. When she woke up, it was late afternoon, and the light through the curtains was the amber of 4 o'clock, and she lay still for a moment and assessed herself in the methodical way she always did when coming out of sleep, in a situation that had recent complications: body, mind, environment, threat level. Body was sore in the specific ways she had cataloged before sleeping. Mind was clearer than it had been since midnight. Environment was her bedroom, unchanged, no sounds that didn't belong. Threat level was lower than it had been in 8 months. She got up. She went to the office and sat at the desk and opened her laptop, and she looked at the document that was saved there, the transcription, the 18 months of careful work, and she read through the last section she had written, checking it the way she always checked it, looking for anything that was imprecise or that relied on inference rather than direct recall. She found 2 phrases she wanted to tighten, and she fixed them, and then she saved the document in its 3 locations and closed the laptop. She picked up the folder from Hale and read the rest of it. All of it, this time, from the preliminary finding through the procedural appendix to the signature block at the bottom, where Hale's name was printed below a line that said, Reviewing Authority, Naval Medical Command. The language was bureaucratic and careful, and it said, in the formal paralanguage of military review boards, that something wrong had been done and was being corrected, and that the record would reflect the correction, and that the person whose record it was had not done anything to warrant the treatment they had received. It said, in the specific way that institutions said things when they were admitting fault without using the word fault, you were right, and we are fixing it, and your name is your name again. She put the folder down. 3 days later, the federal arraignment of Aldrich Sene and 6 Vantage Meridian executives took place in the Eastern District of Virginia. Braddock texted her a single line. Charges filed. Arraignment complete. No bail for Sene. Flight Risk Determination. Claire read it at the nursing station at Harlan County General, where she had returned for her regular shift because the department still needed nurses, and she was still a nurse, and those two facts had not changed. Dr. Fenn had been named interim trauma director pending a formal search process. She ran the department with a quiet authority that was nothing like Graves' authority. It did not need to raise its voice. It did not need to make anyone small. It simply knew what it was doing and did it. And the department responded the way departments responded to that kind of leadership, which was by functioning better than it had in years. Marisol had gotten the full explanation in a 90-minute conversation at a diner 2 miles from the hospital over coffee and pie. She had listened the entire time without interrupting, which was extraordinary for Marisol, and when Claire finished, she had sat quietly for a moment and then said, "So the bruise on your shoulder that time, in September." "Yes." "I should have said something." "You did say something. You told me not to let him get in my head." "That's not the same as filing a complaint." "No," Claire agreed. "It's not." Marisol had looked at her pie. 4 nurses before you filed complaints. All 4 were pushed out. "I know." "You knew then?" "I read their files when I got here." Claire had looked at the window of the diner at the main street of Callaway Creek in the afternoon. "I couldn't file a complaint. I couldn't do anything that created a formal record. I needed to be invisible." She paused. "I'm sorry I wasn't able to do more for them, faster." Marisol had been quiet for a long time after that. Then she had said, with the particular directness of a woman who had spent 11 years watching something wrong continue and had grown tired of it, "They're going to hear what happened, all 4 of them, Graves in federal custody. They're going to hear that." She'd looked at Claire. "That matters." It did matter. It mattered in the way that things mattered when they couldn't undo what had already happened but could change what it meant going forward. The shape of the wrong made visible, named, assigned its correct weight, carried by the person who had committed it, instead of the people who had been damaged by it. The formal complaints that the 4 former nurses had filed were entered into the federal case file against Graves. A 5th complaint was filed by a current Harlan County general nurse who had not previously come forward. Then a 6th. The hospital's HR department, operating under new interim leadership after Gerald Fitch had quietly submitted his resignation, opened a formal review process. It was not fast. It was not clean. It involved lawyers and uncomfortable conversations, and a period of institutional uncertainty that was difficult for everyone working there. It was also necessary, and it was happening, and that was more than could have been said 6 weeks ago. The deposition took place over 2 days in a federal building in Charleston, in a room that was not designed for comfort and was not trying to be. Across the table were 2 federal prosecutors, a JAG officer, Braddock, and a stenographer who typed with extraordinary speed and an expression of complete professional neutrality. Claire answered every question she was asked with the precision she had been building toward for 3 years. And when the questions were done and the transcript was certified, and the prosecutors looked at each other across the table with the particular look of people who have just received something significantly more useful than they expected, one of them, a young man in his 30s named Garrett, who had been working the Vantage Meridian case for 14 months, said simply, "Thank you, Commander." Not Ms. Whitmore. "Commander." She had corrected people on the title for 3 years. She didn't correct him. The trial of Aldrich Seney and the Vantage Meridian executives was set for 14 months out, which was the federal court timeline. In the interim, 3 of the 6 executives entered plea agreements. They produced documentation, communications, financial records, the long paper trail of decisions made by people who had believed they were making them from a position that couldn't be touched. The documentation confirmed and extended what Claire had reconstructed from memory. It named names above the contractor level, into the government contractor oversight space, where Vantage Meridian had spent years cultivating protection. 2 of those names were in positions of federal employment. Both resigned within a week of the documents becoming part of the public court record. Graves cooperated, as Braddock had predicted. He did it without dignity and without any apparent recognition that what he had done required more from him than a calculation about his own sentence, which was perhaps the most clarifying thing about him. The absence of remorse was not hidden behind anything. It was just there, the clean face of a man who had been cruel because it was useful, and had taken money because it was offered, and had never spent a moment considering what any of it cost the people it had been done to. He received a sentence of 22 years on the federal charges: conspiracy to endanger federal witnesses, assault, unauthorized disclosure of a protected individual's location, and several counts relating to his role in the broader Vantage Meridian network. The medical board revoked his license permanently at a hearing that took 40 minutes. The 4 nurses who had filed the original complaints were notified of the outcome by the hospital's patient advocate. Claire did not attend the sentencing. She was in the middle of a shift when it was handed down, and Braddock texted her the number, and she read it, and she went back to the patient in bed 3 who needed his IV site changed, and she changed it. Webb's shoulder surgery happened at a Level 1 center in Pittsburgh, 11 days after the night at Harlan County General. It took 4 hours and went as well as shoulder surgeries that extensive went, which was to say it was successful in the ways that mattered and would require significant rehabilitation and would never be quite what it had been before, because that was the nature of the damage. He texted her from recovery. Surgeon says 80% function at 18 months. I'll take it. She texted back. You'll work the other 20% back yourself. He replied with a single period, which was Webb for yes, obviously. Thank you for understanding that about me. The fragment near his T4 vertebra was monitored rather than removed. Its position stable, the margins safe, the neurosurgery team in Pittsburgh advising watchful waiting over intervention. He would carry it. People carried things. The body accommodated what it had to accommodate and built function around the rest. Okafor went back to his unit after Webb was stable enough for transfer. He stopped in the ER on his way out, at the beginning of Claire's shift, and stood at the nursing station with his cover in his hands. The sailor's hat, held correctly, the way you held it when you were in a professional setting and being respectful. And he said, I'm glad it was this hospital. So am I, Claire said. He started to turn and then turned back. The evaluation you wrote. My instructor gave it to me the day I commissioned. I know, Webb told me. He nodded. He looked like he was going to say something else, and then decided the something else was not necessary, and the nod was sufficient, and he put his cover back on and left. The review board issued its final determination 6 weeks after the preliminary finding. Claire was in her office at home when Hale called, not texted, called, which meant it was the kind of information that needed a voice attached to it. Final determination issued, Hale said. Record corrected, effective retroactive to the original separation date. All commendations reinstated. Rank reinstated. The amendment to your separation documentation has been entered and certified. A pause. Your file now reads the way it should have read 3 years ago. Claire was quiet for a moment. There's one more thing, Hale said. The Naval Medical Command formal recognition. There will be a ceremony. Not large, not public in the media sense, but formal, with your chain of command and the JAG officers who certified the review and representatives from the prosecution. It's a recognition of service under extraordinary circumstances and of the work you did over the last 3 years to preserve evidence that made the prosecution possible. Another pause. I'd like you to be there. When? 3 weeks. I'll be there, Claire said. She accepted the instructor position the following morning. She called Hale and said yes in the same voice she used for everything. Level, direct, without theater. And Hale said good and gave her the administrative contact at Fort Harwick and told her the first curriculum review meeting was in 2 months and that there was no particular urgency, but that the program had been waiting for someone who actually knew what they were doing and it would be glad to have her. She told Dr. Fenn that same week. Fenn took it with the composure of someone who had expected it and had already begun thinking about coverage. We'll miss you, she said, and meant it the way practical people meant things. Not as sentiment, but as an accurate operational assessment. I'll be 60 miles away, Claire said. I know, but the nights you were here had a different quality. Fenn paused, which was not something Fenn did often. The nurses know that. They won't all say it, but they know it. Claire thought about what to say to that and decided that there was nothing adequate, and that adequacy was not the point. Take care of this department, she said instead. That's what I do, Fenn said. She spent her last 2 weeks at Harlan County General the way she had spent every shift before them, working, moving through the department, doing the job. Marisol organized a small gathering on the last night, the night shift people coming together in the break room with a cake that said simply CW on it in green frosting because Marisol had been the one to order it, and Marisol had decided that was enough, and she was right. Patton was there. slightly less recalibrated than he'd been in the days after the incident, having returned to something approaching his regular self, which was a person who talked about football and cared genuinely about the people who worked the building he secured. He shook Claire's hand and said, "I'm glad you worked here." And she said, "So am I." And she meant it entirely. She drove to Fort Harwick for the first time on a Tuesday in November, 60 miles north through mountain roads that were beginning to ice at the edges, but were still passable at a careful speed. The base was larger than she'd known from a distance. Most of what she'd been able to observe from the valley was the outer fence and the antenna structures, and it smelled of institutional food and diesel and the specific institutional cleanliness of military facilities that she had grown up in professionally and had not smelled in 3 years. She felt something when she drove through the gate. Not relief? Not quite. Something more complicated. The recognition of a place that was native to her, a context her body understood, combined with the knowledge of what it had cost to return to it, and the clarity that the cost had been worth paying because the alternative had been to let what had been taken from her stay taken, and she had never been built for that. The curriculum review meeting was in a building that smelled of coffee and whiteboard markers, around a table with 7 people who were all significantly younger than she was in terms of operational experience, and who looked at her with the particular attention of people who have been told someone important is coming and are in the process of discovering whether that assessment matches what walked through the door. She looked back at them with the flat gray eyes that had never quite matched her timid act, except that the act was gone now, and there was no performance layered over the thing behind the eyes. "I'm Commander Claire Whitmore," she said, and the title sat in the sentence the way it was supposed to, not as a claim being made, but as a fact being stated. "I'm going to teach you things that will keep people alive in conditions that are trying to kill them. Some of what I teach you will save lives years from now in situations neither of us can predict. That's how medical training works. It travels forward in time through the people who carry it." She looked around the table. "Let's get started." The recognition ceremony happened on a Friday, in a room at the Naval Medical Command building in Bethesda that was formal without being large. The people in it were the ones who mattered to the matter at hand. No press, no performance, just the clean fact of an institution acknowledging what it had done wrong and what had been done right in the absence of its support. Hale presided. Braddock was there, in her NCIS credentials, standing slightly to the side with the posture of someone who had finished a long piece of work and was still in the process of putting the weight of it down. 2 of the JAG officers who had certified the review board were there, a representative from the federal prosecutor's office. And in the back row, in civilian clothes because he had not yet returned to duty and would not for some months, was Webb. His arm was in a sling, and his color was better than it had been in Pittsburgh, and he was holding himself with the particular careful stillness of someone whose body was in a renegotiated relationship with its own structural integrity. Hale read from the formal determination. The language was institutional and precise and said what it said without flourish, because the facts didn't need flourish. They needed to be said clearly and correctly and permanently, which they were. When it was done, there was a brief silence in the room, the kind that wasn't empty but was full of something that didn't resolve easily into words or motion. Then Hale looked at Claire and said simply, "Do you want to say something?" Claire had not prepared anything. She had considered preparing something and had decided against it because the things she needed to say were not the things you prepared. They were the things you said from the place where the experience had actually lived, unedited and direct. "When I was a young medic," she said, "someone told me that the work of medicine was not about the moment of intervention, that the moment was important but it wasn't the work. The work was everything before it, every training session, every case review, every time you made yourself understand something completely instead of just well enough. The moment was just the moment. The work was everything that made the moment possible." She paused. "I spent 3 years in a place where the moment kept coming and the work kept being necessary, and the institution that had trained me for both of those things had removed itself from my record. I kept doing the work anyway, because the work didn't belong to the institution. It belonged to the people who needed it." She looked around the room. "That's what I want people who are watching to understand. Not that I was exceptional, that the work is the thing. The work travels. It lives in the people you teach, and the decisions you make at 3 in the morning when nobody is looking, and the cases you review long after the shift is over. It doesn't stop because you're told your file says something different than what you know to be true about yourself." She paused. Know what's true about yourself. Do the work from that place. The record will catch up eventually. The room was quiet. Then Braddock put her hands together, and Hale followed, and the room followed Hale. And it was not a standing ovation because this was not that kind of room. It was the measured, genuine applause of people who were there because something real had happened and were acknowledging it with the appropriate weight. In the back row, Webb was not applauding. His arm was in a sling, and applauding was physically impractical. He was just looking at her with the expression she had been seeing on his face for 12 years in various configurations, the one that meant he understood something clearly and was glad to understand it. She looked back at him. After, in the corridor, he came to her and they stood together the way they had stood together in a lot of corridors, in a lot of buildings, in a lot of contexts that had been difficult and important, and he said, "Fort Harwick." "Fort Harwick," she agreed, 60 miles from Callaway Creek. "Yes." He looked at the corridor ceiling for a moment. "You're going back." "I'm already back," she said, and she meant the work, and she meant the record. And she meant the thing that hadn't stopped being true even when the document that should have reflected it had been made to say otherwise. She had always been the thing she was. It had simply been invisible for a while, to everyone except the patients who needed it, and the people who watched her provide it, and the young medics in the curriculum review room who were already carrying forward what she was teaching them. She had never actually been erased. They had just turned off the light for a while, and she had done the work in the dark. That was the thing about people who were genuinely built for something. You couldn't make them stop being it by removing the paperwork. You couldn't silence something that was expressed in every decision, every intervention, every moment of choosing correctly under pressure. The record could say one thing, and the reality could say another, and over time the reality won, not because the world was fair, but because the work accumulated and the evidence stacked up, and eventually the light came back on, and what had been there all along was visible again. You didn't need someone else to recognize you first. You just had to keep going until they caught up.